accepted. Swiggy it.
Alright, hi guys, a very good evening to all of you guys. Welcome to our today's YouTube session where we are going to discuss Das Ka Dam. And what is the overall concept of Das Ka Dam? I think you guys have been attending this session already. Let me give you a quick introduction about this series, and I'm pretty sure each one of you, those who are going to attend this, you are going to enjoy this session of Das Ka Dam. In this series of Das Ka Dam, the important things that we'll be covering are going to be top 10 drugs. सबसे पहले हम बात करेंगे top 10 drugs. Then there will be top 10 images. Although in pharmacology there is not much image, but what all images that has been asked in the previous 5-6 years, and what could be the potential MCQ in the upcoming examination, we'll be covering that. And apart from that, top 10 MCQs. So this is what we are going to discuss. This is going to be 1.5 to 2 hour session, but I'm pretty sure that in this time that we are going to spend, each one of you are going to revise some of the very important drugs, some of the very important topics in pharmacology. Before I start this session, please give me a quick confirmation if I'm clearly audible and visible to all of you guys. डॉक्टर प्रत्युषा, डॉक्टर कार्पेल टनल, चांद बाबू, आ जाओ ना प्लीज़. आ गया ना मैं प्लीज़. बताइए सब ठीक है? ऑडियो वीडियो ऑल गुड? कैन वी स्टार्ट? Can we start this session? All the students, those who are live right now, can give a quick confirmation. All right, great. So सबसे पहले हम बात करेंगे top 10 drugs. And now most of the drugs that we are going to discuss here, guys, if you realize, I have brought it pre-written so that we can save some of our times, because our main purpose is to mainly revise these drugs and to make sure that we go through the important topics that could be asked. Yes, Dr. Khan, alaikum salam. Then there is Achan Khan, how to Dr. Sai Chand is asking how to enroll for rapid revision, which starts from 15. You just have to go to the app, download the app, and you will be directly taken to that part. है ना. आप ऐप डाउनलोड करिए, आपको ऑटोमेटिकली बैचेस में जाइए, एंड बैचेस में जाके आपको बस एनरोल करना है. इफ़ यू आर हैविंग एनी मोर प्रॉब्लम, वी कैन हेल्प यू आउट. आप टेलीग्राम ग्रुप में एक मैसेज डाल दीजिए. आवर टीम विल गेट बैक टू यू एज सुन एज वी कैन. चलो स्टार्ट करते हैं टॉप 10 ड्रग्स. तो वन बाय वन एक ड्रग के बारे में बात करते हैं. सबसे पहले ड्रग्स के बारे में बात करना चाहता हूँ मॉर्फिन. नाउ मॉर्फिन पे क्या क्या क्वेश्चन आए हुए हैं और क्या क्या क्वेश्चन आ सकते हैं, एवरीथिंग वी आर गोइंग टू रिवाइज इन आवर दिस सेशन. ओके, फर्स्ट एंड फॉरमोस्ट रिमेंबर, मॉर्फिन इज वन ऑफ द ओपियोइड, है ना, एंड दे आर मेनली गोइंग टू बी डिराइव्ड फ्रॉम विच पार्ट? डिराइव्ड फ्रॉम पैपावर सोमनिफेरम. पैपावर सोमनिफेरम. ठीक है. Now opioid mainly is going to act at the receptor. So what is the name of the receptor of the opioid? We already know the name of the receptor is mu kappa delta. Mu kappa delta is the name of the receptor. Mu receptor is mainly involved and responsible for the euphoria. Kappa is mainly involved and responsible for the dysphoria, and delta is mainly for the analgesia. However, analgesia is the property of all of them. Let's repeat again. I told you mu kappa delta. Mu kappa delta. Mu will be mainly for the euphoria. Kappa है ना, kappa कड़वा, तो dysphoria you can remember like this, dysphoria, and delta is for the analgesia. However, analgesia is going to be the property of all the receptors. I repeat, analgesia is the property of all the receptors, right? Now what are the different action that we are having of these opioid receptors? Usually majority of the opioids are having this property, that is physical dependence. Euphoria is mainly occurring because of the mu receptor. Analgesia by R, all the receptor, but mainly by the delta receptor. Sedation, opioid receptor, they will also be causing sedation. Constipation, analgesic effect, है ना. एनाल्जेसिक इफेक्ट अगेन आई टोल्ड यू दैट विल बी कॉज्ड बाय द म्यू रिसेप्टर को दो पार्ट में भी डिवाइड किया गया, सुप्रा स्पाइनल एंड स्पाइनल, बट अगेन यू डोंट हैव टू वरी अबाउट दैट. जस्ट रिमेंबर दैट these are the different properties on the respiratory system. They are going to cause respiratory depression. In addition to this, I would like to highlight few more important points. In addition to this, opioid का other क्या action होगा? For example, at the smooth muscle, remember opioid at the smooth muscle, they cause smooth muscle का contraction. At all the sphincters, remember at all the sphincters, opioid is going to increase the tone of all the sphincters. If I'm going to ask you a smooth muscle like bronchial smooth muscle, so they can cause bronchoconstriction. I repeat, sphincter pe they are going to increase the sphincteric tone, right? That is why if I ask you what is the effect of opioid on a bladder, so bladder पे क्या effect आएगा, इसका एक example मैं आपसे पूछा, आप जवाब दीजिएगा. Example, at the bladder they can increase the sphincteric tone, so remember they can increase the risk of urine retention. ये आपको ध्यान में रखना है, they can increase the risk of urine retention. That is point to be noted. ठीक है, and that explains the fact why opioid as an agent should always and always be contraindicated in BPH patient. Benign prostatic hypertrophy patient में they are going to be contraindicated. Do remember that. So morphine is my top 10 drugs का पहला ड्रग है और बार बार इससे क्वेश्चन आता है. अब टॉप 10 ड्रग्स जो मैं डिस्कस करूंगा आप देख के खुद भी स्माइल करोगे कि सर आपने ड्रग्स वही सारे पिक किए हैं जहाँ से क्वेश्चन डेफिनेटली आता है. तो मैं बोल रहा हूँ अगर 5 ड्रग पढ़ा रहा हूँ उसमें 10 ड्रग पढ़ा रहा हूँ उसमें से 5 टॉपिक पे भी क्वेश्चन आ जाते हैं. सो दिस इज going to be a win-win situation for all of you guys. Remember, these are the different action of opioid. If on the smooth muscle, like let's say a pupillary circular iridis muscle पे they are going to cause contraction, तो eyes में मैं पूछूं कि what is the effect of opioid, so you can easily tell me, sir eyes में तो meiosis करेगा. If there is opioid toxicity, remember they can even lead to a condition called your pinpoint pupil. So excessive meiosis will be known as what? Pinpoint pupil. Now please remember, आइज के स्मूथ मसल में मॉर्फिन का डायरेक्ट एक्शन नहीं होता है. वो मैंने समझाने के लिए आपको बोल दिया कि मायोसिस मेनली है किसके वजह से होता है, ड्यू टू सर्कुलर आइरिडिस मसल. बट ऑन द सर्कुलर आइरिडिस मसल देयर इज नो रिसेप्टर ऑफ ओपियोइड. आई रिपीट, आइज में देयर इज नो ओपियोइड रिसेप्टर. पॉइंट टू बी नोटेड हियर. वाई? तो आप बोलोगे सर ये फिर मायोसिस करता कैसे है. रिमेंबर दे आर गोइंग टू कॉज मायोसिस बाई एक्टिंग एट द एडिंगर वेस्टफाल न्यूक्लियस. EWN, एडिंगर वेस्टफाल न्यूक्लियस पे काम करके दे विल बी कॉजिंग मायोसिस. प्लीज रिमेंबर देयर इज नो direct opioid receptor on the circular iridis muscle. However, the meiosis will definitely happen due to circular iridis muscle. So cranial nerve 3 है ना, that is mainly involved in the meiosis are mainly उसका न्यूक्लियस एडिंगर वेस्टफाल न्यूक्लियस पे है. ठीक है, so do remember this. These are the different action of the opioid. Now next thing that I wanted to discuss with all of you guys, their mechanism of action. So opioid at the presynaptic receptor, let's assume that this is one of the presynaptic receptor and this presynaptic neuron, and this is one of the postsynaptic neuron. Presynaptic and postsynaptic we have seen already, right? Now this is one of the nociceptive neurotransmitter. Nociceptive neurotransmitter का मतलब क्या हुआ? Any neurotransmitter that is going to produce or giving you a feeling of sensation of pain. तो यहाँ पे एक न्यूरोट्रांसमीटर होगा जिसका नाम होगा नोसिसेप्टिव न्यूरोट्रांसमीटर. वेन एवर दिस नोसिसेप्टिव न्यूरोट्रांसमीटर इज गोइंग टू रिलीज दे विल बी गिविंग यू फीलिंग और सेंसेशन ऑफ द पेन. नाउ नोसिसेप्टिव न्यूरोट्रांसमीटर के रिलीज के लिए ऑलवेज रिमेंबर फॉर द नोसिसेप्टिव न्यूरोट्रांसमीटर टू रिलीज there should be depolarization of the neuron, and presynaptic पे there is a calcium channel. तो calcium influx होगा, there will be influx of the calcium, and this influx of the calcium will be causing depolarization of the neuron. Now on the postsynaptic there is actually going to be potassium channel, and potassium channel is, if you want to cause the transmission of this information across the neuron, the potassium channel ideally should be closed. Potassium channel ideally should be closed, because if potassium channel is open there will always and always be efflux of the potassium. So how opioids are mainly going to work? Opioid कैसे काम करेगा? Remember, ये presynaptic में at the presynaptic neuron they are mainly going to act by causing प्रीसाइनेप्टिक कैल्शियम चैनल ब्लॉकेड, एंड पोस्ट साइनेप्टिक पे ये पोटेशियम को ओपन करके काम करेंगे. दे आर गोइंग टू ओपन द पोटेशियम चैनल, एंड आई थिंक आई जस्ट क्लैरिफाइड विद ऑल ऑफ यू गाइस दैट अगर पोटेशियम चैनल ओपन होगा सो दे विल बी कॉजिंग इफ्लक्स ऑफ द पोटेशियम. सो प्री साइनेप्टिक पे कैल्शियम चैनल को ब्लॉक कर दिया, and post synaptic way they are going to act by opening the potassium channel, therefore they are going to lead or they are going to cause your potassium का efflux. Ultimate हमारा aim क्या है? We do not want to cause the depolarization of the neuron. We do not want to cause the depolarization of the neuron. We do not want this nociceptive neurotransmitter to work. ठीक है, we do not want this nociceptive neurotransmitter to work. मेकिंग सेंस? तो ये मैकेनिज्म ऑफ एक्शन हो गया. नेक्स्ट, द डिफरेंट कॉन्ट्राइंडिकेशन. द डिफरेंट कॉन्ट्राइंडिकेशन यू कैन जस्ट रिमेंबर बाय द सिंपल नेमोनिक 5H3, राइट, 5H3B. नाउ व्हाट आर दोस? दैट इज गोइंग टू बी हाइपरट्रॉफी ऑफ द प्रोस्टेट. If there is already a patient of hypertrophy of prostate या benign prostatic hypertrophy, in any of this scenario, remember, we will not be giving. Why? Because they are causing is increase in the sphincteric tone. We have already studied this. Opioid at the high dose, remember, not at the therapeutic dose, but opioid usually at the high dose, they are having some effect on the heart. I said not at the therapeutic dose. At the therapeutic dose, they do not have much effect on the heart. At the high dose, they are going to have a cardiac depression property. They can decrease the blood pressure, decrease the heart rate. So if there is already a known case of hypotension and bradycardia, ऐसे patients को हम नहीं देते. हेड इंजरी में ओपियोइड दे देमसेल्फ विल बी इंक्रीजिंग द इंट्राक्रैनियल प्रेशर, एंड हेड इंजरी में ऑलरेडी इंट्राक्रैनियल प्रेशर हाई है, तो वी विल नॉट बी गिविंग देम. हाइपोथायरॉइड पेशेंट में, हेपेटिक डैमेज पेशेंट में, देयर इज ऑलरेडी हेपेटिक फेल्ड पेशेंट, अगेन द मेटाबॉलिज्म विल बी हैम्पर्ड. मेटाबॉलिज्म विल नॉट टेक प्लेस एंड देयर विल बी रिस्क ऑफ ओपियोइड टॉक्सिटी. सो इस सारे कंडीशन में 5H3B विल बी बिलियरी कोलिक और एनी अदर कोलिक लाइक रीनल कोलिक और कोलिक की एब्डोमिनल पेन. किसी भी कोलिक में नहीं देंगे. दिस क्वेश्चन हैज ऑलरेडी बीन आस्क्ड. ब्रोंकियल आस्मा में नहीं देंगे, सीओपीडी में नहीं देंगे, बेबीज में भी नहीं दिया हमने, बेबीज में भी नहीं दिया, एंड पैंक्रेटाइटिस. इन पैंक्रेटाइटिस ऑल्सो वी आर नॉट गोइंग टू गिव. सो दीज आर द डिफरेंट कॉन्ट्रा इंडिकेशन. डू रिमेंबर, कॉन्ट्रा इंडिकेशन आर ऑलवेज गोइंग टू बी ए पार्ट. The question that was asked is, intern is posted in a ward and the patient complained of pain. He injected a drug. After that, the pain got aggravated. Which drug has possibly caused this? Which drug has possibly caused this aggravation of the pain? So you have to choose one of the opioid agent in that option. I'll show you that question as well. Now, if opioid is such a potent analgesic agent, what is the problem? One of the important problem with opioid is the dependence. Other problem is tolerance. What is the meaning of tolerance? Same dose does not produce, when the same dose doesn't produce similar effect, when the same dose doesn't produce similar effect, उसको हम बोलते हैं क्या? टॉलरेंस. We call it as a tolerance when the same dose does not produce a similar effect, and tolerance will develop to all of them, like even for your euphoria, even for analgesia. For example, if one dose is causing a analgesia today, it's not necessary that the same dose can cause analgesia after a week, है ना? तो उससे अब टॉलरेंस डेवलप हो सकता है. आफ्टर 1 week 2 week maybe the same dose may not cause. So you have to increase the dose in order to achieve the same level of analgesic effect, or if you are taking it for euphoric effect, you have to increase on the dose, and as you keep on increasing the dose, your dependence on the drug keeps on increasing. ठीक है. But the thing is, tolerance doesn't develop to 3 important conditions that I always say most common cause: meiosis, constipation, and convulsion. Or we also remember it by triple C, that is constriction, pupillary constriction, constipation, and convulsion. What is the meaning of that? If one dose is causing meiosis today, the same dose can cause meiosis after 1 month, 6 months, 1 year, है ना? तो उससे कोई tolerance develop नहीं होता है. Next problem with the opioid, why we are not using on the regular practice, like let's say if I ask you, you are having headache, can you use opioid right now? Or you are having headache morning and evening, 1 week में 3 दिन headache रहता है, can you use opioid on the regular basis? The answer is no. One of the reason is your risk of abuse potential and dependence. Dependence will be psychological dependence, where the patient is going to have a craving behavior, and other one is going to be your physical dependence. Physical dependence को ही हम बोलते हैं withdrawal symptom. That means if the person does not receive the drug, now he will develop some symptom. Physical dependence में the patient will show some signs and symptoms. There will be some signs and symptom if you stop the opioid. है ना? Initially psychological में there is no signs and symptom. There will be one there is just craving behavior, है ना? पेशेंट को लगेगा काश थोड़ा मिल जाता, है ना? ही विल जस्ट कीप ऑन थिंकिंग काश, बट फिजिकल में नहीं मिला तो ही विल स्टार्ट टू शो फिजिकल साइंस एंड सिम्टम. डू रिमेंबर, The physical signs and symptom of opioid is exactly opposite to the actual effect of the opioid. I am telling you, I repeat, withdrawal symptom is not same as toxicity. Repeat, withdrawal symptom is not same as toxicity. In toxicity, the effect is going to be the increased effect of opioid का जो effect था वही थोड़ा बढ़ के आएगा, that is toxicity. But withdrawal effect में there will be opposite action. For example, opioid is mainly used for let's say analgesia. So withdrawal में there will be excessive pain, or we also call it as a hyperalgesia. Sometimes we also call it as a hyperalgesia, excessive pain, hyperalgesia. Opioid can cause respiratory center depression. There will be hyperventilation in withdrawal symptom. Opioid can cause bronchoconstriction. Opioid can also suppress the cough center, but withdrawal symptom there will be coughing. Opioid in GI can cause constipation, but withdrawal में क्या आया? Diarrhea. Pinpoint pupil कर रहा था, withdrawal में mydriasis. There will be hypertension. There will also be increase in the heart rate. Withdrawal symptom का एक effect है which has not been discussed so far. Remember, it's piloerection, erection of the pilosebaceous unit, erection of the pilosebaceous unit or pilosebaceous gland. So these are the withdrawal symptom. Please remember, withdrawal symptom is again a type of it's a physical dependence. So physical dependence का जो symptom आता है, we are going to call it as a withdrawal symptom. I hope it is making sense to all of you guys. Withdrawal symptom not same as, withdrawal symptom is not same as opioid toxicity. Opioid toxicity में क्या आएगा? If I just quickly clarify here itself, because हम लोग रिवाइज ही तो कर रहे हैं. What is the symptoms of toxicity? Symptoms of toxicity. Head to toe जाइए, head to toe. Start from the eye. So eye में there will be pinpoint pupil. There will be pinpoint pupil. Then go a little more down. You can talk at the level of heart. Heart पे withdrawal symptom में there was tachycardia, there was hypertension. Here there will be again increased action of the opioid. So opioid at the high dose, they can cause bradycardia, they can also cause hypotension. So decrease in the heart rate, decrease in the blood pressure. ये बहुत important चीज़ है ना, बहुत important topic है. A drug addict with pinpoint pupil and bradycardia, hypotension, most likely it will be a case of opioid. A drug addict with increase in the heart rate, most likely it will be a case of cocaine, है ना. ध्यान रखिएगा, ये मैं फिर से आपको समराइज कर रहा हूँ. Cocaine is also drug addict. So drug addict, they don't jump on the conclusion of the opioid, or just by looking at the pinpoint pupil don't think it's going to be opioid. Pinpoint pupil can also present with your organophosphate and carbamate. So in majority of the organophosphate poisoning जो case आता है उसमें there will be history of farmer with pinpoint pupil, organophosphate, carbamate, antidote उसका atropine है. ठीक है. Now if there is a drug addict with pinpoint pupil, remember there will be pinpoint pupil, decrease in the blood pressure and decrease in the heart rate. लेकिन cocaine में pinpoint pupil नहीं होगा, because cocaine actually inhibit the reuptake of norepinephrine. Therefore in cocaine toxicity, cocaine का अगर toxicity हो जाए, so in that case scenario there will be increase in the blood pressure, increase in the heart rate, and because they are inhibiting the reuptake of sympathetic catecholamines, remember there will also be mydriasis. इसका कोई specific antidote नहीं है, we just do the supportive management. एंड अगर मान लीजिए किसी पेशेंट का बीपी बढ़ गया तो वी डू सपोर्टिव मैनेजमेंट, टैकीकार्डिया हो गया तो वी डू सपोर्टिव मैनेजमेंट. जैसे जैसे सिम्टम आ रहा है उसको मैनेज करते हैं. ओपियोइड टॉक्सिसिटी में अगर आप देखते हैं और किसी लेवल पे जाते हैं, लेट्स से जीआई के लेवल पे, तो ओपियोइड टॉक्सिसिटी में देयर विल बी कॉन्स्टिपेशन, सीवियर कॉन्स्टिपेशन हो सकता है पेशेंट को. ठीक है. देयर विल बी रेस्पिरेटरी सेंटर डिप्रेशन. तो पेशेंट को कई बार रेस्पिरेटरी सेंटर डिप्रेशन की वजह से रेस्पिरेटरी एसिडोसिस वाली चीज़ें भी आएंगी. रेस्पिरेटरी सेंटर डिप्रेशन. So patient can have some metabolic derangements as well. इसका एंटीडोट क्या होगा? What is the antidote? The antidote of opioid toxicity is actually going to be your naloxone. Naloxone is one of the opioid antagonists. Remember that. All right. Other opioids like L-fentanyl, fentanyl, sufentanil and remifentanil. Sufentanil को बोलते हैं it's the most potent opioid. Sufentanil is the most potent opioid. Remember that its potency is around 1000 times as compared to morphine. So it is considered as the most potent opioid. ठीक है, most potent opioid. Mainly we are going to use them in procedures like coronary artery bypass grafting. They are associated with post-op muscle rigidity or chest wall muscle rigidity. Sometimes we also term it as a wooden chest. Remifentanil is the shortest acting. They are mainly utilized for the daycare procedures. Opioid of choice in daycare procedure, we can use this one. Remifentanil हम यूज कर सकते हैं. अगर फास्टर एक्टिंग यूज करना है तो वी कैन यूज ड्रग्स लाइक योर फेंटानिल. फेंटानिल इज 100 times more potent as compared to your opioids. ठीक है. The most common cause of death in opioid poisoning is another question. That is going to be your respiratory depression is the most common cause. Respiratory center depression is the most common cause in the opioid poisoning. These are the three important antagonists. इसको बोलते हैं opioid receptor antagonist. Opioid antagonists: naloxone, naltrexone, nalmefene. Naloxone, naltrexone, nalmefene. Among this, opioid poisoning antidote is going to be your naloxone, which is the fastest acting and IV routes available है. Naltrexone is one of the drug that is slower acting, orally है, longer duration of action है. They are utilized in the management of the opioid de-addiction. So after methadone substitution therapy, we used to add a drug, MST मतलब methadone substitution therapy. We add a drug that is naltrexone. Naltrexone is also one of the drug that is going to decrease the alcohol craving, and it's also one of the anti-obesity drug. It's also one of the anti-obesity drug. Alright. Nalmefene का एक्शन इज क्वाइट सिमिलर टू नैलॉक्सॉन ओपियोइड पॉइजनिंग में एंड ऑल्सो इन द कोलेस्टेटिक प्रोराइटस में वी कैन यूटिलाइज. तो nalmefene is available by IV and oral route both. Nalmefene is also one of the opioid antagonist. In addition to this, I would like to discuss one more important information here. एक और चीज़ मैं बता दूं आपको opioid से related, that a drug that is recurrently being asked in the topic of opioid is called your tramadol, tapentadol. A drug that is recurrently being asked is known as your tramadol. It's an opioid analgesic agent. It is a mu opioid receptor agonist with SNARI, that is serotonin noradrenaline reuptake inhibitor. SNARI, they are going to increase the level of serotonin. They will also increase the level of noradrenaline. One more agent that we are having is called your tapentadol. Tapentadol. It is one of the mu receptor agonist with NARI. NARI is a noradrenaline reuptake inhibitor. Remember, यही क्वेश्चन जो आया था कि एक पेशेंट जो वार्ड में थी और उसको एक इंटर्न ने इंजेक्शन लगा दिया था, तो पूछा कौन सा ड्रग होगा, विच ड्रग विल बी प्रेसिपिटेटिंग दिस पेन, तो ट्रामाडोल उसके ऑप्शन में था. इट्स अ ओपियोइड एनाल्जेसिक. रिमेंबर, ऑल दीज ओपियोइड एनाल्जेसिक्स दे आर ऑलवेज गोइंग टू बी contraindicated in biliary colic or any other colicky abdominal pain. Biliary or any other colicky abdominal pain, because they will be causing a smooth muscle ka contraction. They are going to cause a smooth muscle ka contraction. Remember that. Then if the examiner is going to ask you treatment of opioid induced constipation, for opioid induced constipation we can actually utilize a peripherally acting mu opioid receptor antagonist. Peripherally acting mu opioid receptor antagonist. So what are the peripherally acting mu opioid receptor antagonist? That is actually your MAN. MAN stand for your methyl naltrexone. MAN stand for methyl naltrexone, Levimopan, and other one is called your naldemidine. Naldemidine. Now the good news is that with this class of drug, there is a peripherally active mu opioid receptor antagonist. They do not precipitate withdrawal symptom. That is the advantage. They do not precipitate withdrawal symptom. तो अगर विड्रॉल सिम्टम को प्रेसिपिटेट किए बिना ओपियोइड एंटागोनिस्ट को यूज़ करना है, सो यू कैन एक्चुअली यूटिलाइज दिस मिथाइल नैल्ट्रेक्सोन, एल्वीमोपैन एंड नाल्डेमिडिन. तो ये हो गया एक ड्रग जिसके बारे में मैं डिस्कस करना चाह रहा था आपसे. द नेम ऑफ द कंपाउंड इज कॉल्ड योर ओपियोइड, है ना. ओपियोइड या मॉर्फिन को मैंने जो भी क्वेश्चन आ सकते थे आए हुए मैंने कवर कर लिया. नेक्स्ट इज गोइंग टू बी योर वैल्प्रोवेट विच इज वन ऑफ द voltage gated sodium channel blocker. It is one of the voltage gated sodium channel blocker. It is one of the very commonly utilized anti-epileptic drug. Not only that, they are also having transient type calcium channel blocker. They also increase the GABAergic activity. Now GABAergic activity is mainly done by two important reasons. They are having GABA transaminase inhibiting property, GABA transaminase inhibiting property, and they are also having succinic semi-aldehyde dehydrogenase inhibiting property, SSA, succinic semi-aldehyde dehydrogenase inhibiting property. If you are wondering what is SSA, what is actually SSA dehydrogenase, तो मैं उसका फुल फॉर्म यहाँ साइड में लिख दे रहा हूँ, succinic semi-aldehyde dehydrogenase, succinic semi-aldehyde dehydrogenase, succinic semi-aldehyde dehydrogenase. Okay, succinic semi-aldehyde dehydrogenase, they are actually, this is one of the intermediate enzyme that is causing metabolism of this GABA. Valproate is one of the anti-epileptic drug. Among the first line anti-epileptic drug, they are having potent enzyme inhibiting property, and we have studied this a couple of times already, that enzyme, most of the anti-epileptic drugs are inducer, valproate is the inhibitor. If you have attended any of my class before, I used to tell you peacock वाला आएगा inhibit करके जाएगा. Enzyme inhibitors are all peacock वाला. What does peacock वाला stand for? Your protease inhibitor, erythromycin, your amiodarone, your cimetidine, your omeprazole, है ना, ciprofloxacin, all right, and your ketoconazole, and wala will be valproate. These are the enzyme inhibitors. So any drug that are having enzyme inhibiting property, they will increase the risk of toxicity of other drug, because they are risk of toxicity of other compounds. Other compound इनके साथ अगर दिया गया तो उनके risk of toxicity को बढ़ा देंगे, because they are very very potent enzyme inhibitor. प्लीज़ इसका जो मैकेनिज्म ऑफ एक्शन इसको ध्यान रखिएगा. इनफैक्ट अभी रिसेंटली 2022-2023 में नीट पीजी में दे गेव यू नर्व, है ना, नर्व एंडिंग शो किया, उसमें एरो शो किया एट द टू इंपॉर्टेंट लेवल ए और बी, विच ड्रग इज गोइंग टू इनहिबिट ए एंड बी बोथ. सो वैल्प्रोवेट, बिकॉज देर इज ए स्पेसिफिक गाबा ट्रांसअमाइनेज इनहिबिटर. इफ यू नो, इफ यू हैव रेड एनीवेयर, देर इज ए स्पेसिफिक गाबा ट्रांसअमाइनेज इनहिबिटर, गाबा ट्रांसअमाइनेज इनहिबिटर, उसको बोलते हैं विगाबैट्रीन. Vigabatrin is one of the specific GABA transaminase inhibitor, but Valproate luckily is a drug that not only inhibiting GABA transaminase but also inhibiting the succinic semi-aldehyde dehydrogenase. They are the GABA transaminase inhibitor. They are the GABA transaminase inhibitor. Very good, Dr. Carpal Tunnel. So I hope all of you guys are going through this and you are able to recall this because आपके नोट्स में तो है, और जितने लोग अटेंड कर रहे हैं नीट पीजी एस्पिरेंट्स, आप देखिएगा इनमें से डेफिनेटली यू विल गेट बेनिफिटेड बाय द इन्फॉर्मेशन दैट वी आर डिस्कसिंग. वी आर गोइंग टू यूटिलाइज देम एज अ ड्रग ऑफ चॉइस इन ए पेशेंट विद द एटिपिकल एब्सेंस सीजर. Atypical absence seizure, atonic seizure, clonic seizure, myoclonic seizure, Lennox-Gastaut syndrome, Dravet syndrome. In सारे ही condition में it's the drug of choice. In all these condition they are the drug of choice. In fact, in GTCS also they are among the first line drug. The current drug of choice for GTCS that we prefer is lamotrigine. पार्शियल सीजर के लिए करंट ड्रग ऑफ चॉइस इज गोइंग टू बी, पार्शियल सीजर के लिए ड्रग ऑफ चॉइस की अगर बात करेंगे दैट इज गोइंग टू बी कार्बामाजेपिन. दैट इज एन एडिशनल पॉइंट. Not only in epilepsy, but they can also be utilized in other conditions like bipolar disorder. And as a matter of fact, they are drug of choice in rapid cycler. Bipolar disorder में any patient who is having mania and depression more than or equal to 4 cycle in a year, उसको बोलते हैं bipolar disorder. They have also got approval for the prophylaxis of migraine. They are also the drug of choice in Sydenham's chorea. देखिए कितने सारे condition में they are actually the drug of choice. Non-epileptic conditions में like bipolar disorder, Sydenham's chorea, prophylaxis of migraine, है ना. So which anti-epileptic drug is approved for the prophylaxis of migraine? दो ड्रग के बारे में डिस्कस होता है. One is Valproate, other one is Topiramate. जो टोपी पहनता है हेडेक को दूर रखता है. ओके. एब्सेंस सीजर का ड्रग ऑफ चॉइस पूछता है. एक और कई बार बच्चे कंफ्यूज हो जाते हैं. व्हाट इज द ड्रग ऑफ चॉइस फॉर एब्सेंस सीजर? Drug of choice for absence seizure, that is going to be ethosuximide. Examiner पूछा what is the mechanism of action, that is a T type calcium channel blocker, transient type calcium channel blocker at the level of thalamus. ठीक है. Yes, pregnancy definitely they are going to be avoided because they are associated with neural tube defect called spina bifida, है ना, spina bifida. Teratogenic risk इसका सबसे ज़्यादा है, they are actually associated with spina bifida, therefore pregnancy में तो कभी नहीं देंगे. इनफैक्ट currently इसको कैटेगरी X में रखा गया. See, most of the anti-epileptic drugs are kept in category D. D कैटेगरी वो ड्रग होते हैं जिनको दिया जा सकता है if the benefit is more than the risk. If the benefit is more than the risk, D को दिया जा सकता है, but Valproate को X में रख दिया गया. ठीक है. So they are associated with side effect like nausea, vomiting, है ना, alopecia which is reversible, hepatotoxicity. Hepatotoxicity or fulminant hepatic failure is one of the very grave or dangerous side effect of the Valproate. They can also lead to retention of fat that can lead to weight gain. This weight gain in female can actually end up causing polycystic ovarian syndrome. So examiner पूछा what is the gender specific side effect? So gender specific side effect is going to be polycystic ovarian syndrome, that is going to be seen only in the female. Edema, anorexia, tremor, है ना, teratogenic effect, and also they are very potent enzyme inhibitor. Now Valproate का therapeutic plasma concentration usually we discuss is 50 to 100. Valproate का therapeutic plasma concentration is 50 to 100. So I always used to tell you a story and I want you to repeat the story. Listen to my story 60 seconds में and you will remember Valproate forever. Valproate को मैं बोलता हूँ it's like old grandfather of the family who is always and always very active in the familial works and extra familial works. The old grandfather who is in the age group of around 50 to 100. ओल्ड ग्रैंडफादर जिसका एज अराउंड 50 to 100 है, तो 50 to 100 एज से समझ के आप लोग एज इज दैट इज थेराप्यूटिक प्लाज्मा कंसंट्रेशन लेवल. हु इज इफेक्टिव इन द फेमिलियल वर्क्स एंड एक्स्ट्रा फेमिलियल वर्क्स. सो फेमिलियल वर्क्स में तो दे आर हाईली इफेक्टिव, प्लस दे आर ऑल्सो इफेक्टिव इन द एक्स्ट्रा फेमिलियल वर्क्स. सोशल वर्क्स में भी ओल्ड ग्रैंडफादर इज वेरी वेरी, है ना, इफेक्टिव. ओल्ड ग्रैंडफादर नाउ हु हैज लॉस्ट हिज हेयर, हैविंग लॉट्स ऑफ ट्रेमर, गेन्ड वेट. When he was young, he used to take, sometimes in party shots of alcohol. कभी कभी ज़्यादा होता था. तो now he has developed, let's say, liver, pancreas, दोनों जवाब दे रहे हैं. Hepatotoxicity, pancreatotoxicity, है ना, दोनों हैं. So just imagine the old grandfather and you will be able to recall most of the important information, including the side effect. है ना, old grandfather gained weight, lost hair, having tremor, liver, pancreas gone, and old grandfather always inhibit you. If you go for a late night party, if you go any, if you deviate from the right path, he will always stop you. No son, don't go there, don't do this, so he'll always be there to inhibit you. So this Valproate is like the old grandfather of the epilepsy family in the age group of 50 to 100. So 50 to 100 age से याद रखिएगा, therapeutic plasma concentration is 50 to 100. ठीक है. Remember the old grandfather and you will be able to recall all the important side effect in one go. एक बार में सारे side effect को भी याद रख सकते हो. नेक्स्ट एपिलेप्सी में 3 ड्रग के बारे में डिस्कस करूंगा. एक उसमें से एक्सपेक्टेड डेफिनेटली होगा. अदर इज गोइंग टू बी फेनिटोइन विच इज वन ऑफ द ड्रग, एंटी एपिलेप्टिक ड्रग. इट्स ऑल्सो वन ऑफ द वोल्टेज गेटेड सोडियम चैनल ब्लॉकर. दे इनहिबिट द ग्लूटामेट रिलीज. इट्स अ प्रो ड्रग दैट इज फॉस्फेनिटोइन दैट इज अवेलेबल बाय द IV रूट. इट्स अ वाटर सॉल्युबल प्रो ड्रग एंड इफ इट इज गिवन समटाइम रैपिड IV, अगर रैपिड IV पुश दिया गया, सो समटाइम दे कैन इंड्यूस एरिथमिया, वेंट्रिकुलर टैकीकार्डिया. इट इज़ वन ऑफ द ओल्डेस्ट एंटी एपिलेप्टिक ड्रग एंड दे आर वेरी वेरी पोटेंट एंजाइम इंड्यूसर. वेरी वेरी कॉमनली आस्क क्वेश्चन, वेरी पोटेंट एंजाइम इंड्यूसर. और एंजाइम इंड्यूसर से मैंने आपको क्या बताया था, एनी ड्रग हु इज हैविंग एंजाइम इंड्यूसिंग प्रॉपर्टी दे विल इंक्रीज द रिस्क ऑफ ट्रीटमेंट फेलियर. Inhibitor क्या कर रहा था, it was slowing down the metabolism, therefore risk of toxicity was increased. Inducer will induce and they will increase the risk of treatment failure. Rapid metabolism करा देगा. The therapeutic plasma concentration level of Valproate is going to be around 10 to 20 microgram per ml. 10 to 20 microgram per ml. Beyond 20, they start following zero order. This is also one of the example of a drug that follows zero order kinetics. In fact, there are very few drugs that follow zero order, and remember this Phenytoin is one of the drugs that follows zero order, right? Phenytoin is one of the drugs that follows zero order kinetics beyond 20 microgram. Because they are having narrow therapeutic index, remember therapeutic drug monitoring is required with the Phenytoin. It's an anti-epileptic drug, but for your information, I'll tell you that they are also having anti-arrhythmic property. They are one of the class 1B anti-arrhythmic drug. They are 1B anti-arrhythmic drug. We can use them in partial generalized tonic-clonic seizure status epilepticus, maybe we can use. बट नॉन एपिलेप्टिक यूएस आर गोइंग टू ट्राइजेमाइनल न्यूराल्जिया, वेंट्रिकुलर एरिथमिया, है ना, ये इनके कुछ नॉन एपिलेप्टिक यूजेस हैं. ट्राइजेमाइनल न्यूराल्जिया का अगर ड्रग ऑफ चॉइस पूछता है तो रिमेंबर इट्स गोइंग टू बी अगेन कार्बामाजेपिन. Dr. Adi, on the same platform 2 days ago I took a session of strategy for our upcoming FMG aspirants. I would request please search that road ahead strategy by Dr. Siraj Ahmed. You will find on this YouTube channel itself, and you will have a more clarity on this one. In this session we wanted to discuss this top 10 topics, top 10 images and top 10 MCQs. ठीक है. Phenytoin is one of the drug that is associated with the side effect जिसको आप याद कर सकते हैं mnemonic phenytoin से ही, like P450 interaction. What is the meaning of P450 interaction? They are going to cause lots of enzyme induction property, hirsutism, hyperglycemia, and last gum or gum hypertrophy. This gum hypertrophy happens to be the most common side effect of phenytoin. It's the most common side effect. Okay. Early side effect nystagmus, yellow brown skin staining. Phosphenitoin के साथ it can even induce tachycardia, osteomalacia, increasing the risk of fracture. They are also going to interfere with the B12 and folic acid absorption, leading to a very famous anemia, that is megaloblastic anemia. Because of the B12 deficiency, they will also add on to your neuropathies, and that sometime present with the decrease in the deep tendon reflexes. Okay, so phenytoin का side effect ही phenytoin के जैसा ही है. Important, which anti-epileptic drug increase the risk of fracture? अभी यही एक ड्रग है जिसके बारे में मैंने बताया अभी आपको. Which anti-epileptic drug will increase the or will decrease the deep tendon reflexes? That is going to be this one. An anti-epileptic drug which is a potent enzyme inducer, and they are also associated with the hirsutism, gum hypertrophy. Gum hypertrophy is a very rare kind of side effect. Very few drugs are associated with that. One of the anti-epileptic drug is going to be your phenytoin. They are associated mainly with your gum hypertrophy. Plus they are also causing congenital malformation जिसको हम बोलते हैं fetal hydantoin syndrome. Please remember, fetal hydantoin syndrome is caused by your dilantin or phenytoin, and they are associated with the thin upper lip, cleft lip and palate, microcephaly, short digit. In fetal hydantoin syndrome हर चीज छोटा हो जाता है. Everything become छोटा in fetal hydantoin syndrome. Remember that. ठीक है. नेक्स्ट इंपॉर्टेंट ड्रग दैट आई वांटेड टू डिस्कस इन टॉप 10 ड्रग्स इज गोइंग टू बी टोपीरामेट. टोपी पहन के अच्छे काम करने वाला ड्रग. एक स्लाइड में समराइज करेंगे टोपीरामेट को. टोपी पहन के अच्छे काम करने वाला ड्रग. इट इज ऑल्सो वन ऑफ द ड्रग दैट इज हैविंग वोल्टेज गेटेड सोडियम चैनल ब्लॉकिंग प्रॉपर्टी. मेन मैकेनिज्म इज दिस, है ना. उसके अलावा दे आर ऑल्सो एक्टिवेटिंग योर दे आर ऑल्सो हैविंग गाबार्जिक प्रॉपर्टी, गाबा रिसेप्टर एक्टिवेटिंग प्रॉपर्टी, इनहिबिटिंग द अम्पा रिसेप्टर. अम्पा इज एक्चुअली रिसेप्टर ऑफ ग्लूटामेट, है ना. तो voltage gated sodium channel blocker, because of this they are going to decrease the glutamate release. Glutamate is one of the neuroexcitatory neurotransmitter activating the receptor. Which receptor? That is a GABA receptor. GABAergic property sometimes it is seen. They are also inhibiting the AMPA receptor. ठीक है, AMPA receptor. AMPA is a receptor of glutamate. All right, they can actually be utilized in many conditions like एपिलेप्सी में तो यूज़ करेंगे. अगेन इट्स वन ऑफ द एंटी एपिलेप्टिक ड्रग, उसमें कोई डाउट नहीं. प्लस दे आर ऑल्सो गोइंग टू डिक्रीज द एल्कोहल क्रेविंग. दे डिक्रीज द एल्कोहल क्रेविंग, देयर फॉर मेंटेनेंस थेरेपी ऑफ एल्कोहल विड्रॉल सिंड्रोम में इसको यूज़ करते हैं. प्रोफिलैक्सिस ऑफ माइग्रेन. टोपी पहनता है, देखिए कितने अच्छे काम कर रहा है. आपको एपिलेप्सी में भी हेल्प कर रहा है, आपको बाइपोलर डिसऑर्डर में भी हेल्प कर रहा है. इन अ पेशेंट विद द बाइपोलर डिसऑर्डर ऑल्सो इट्स इफेक्टिव ड्रग. It's also not allowing the headache. It's also not allowing you to gain weight. So आप अपना favorite food खाइए and don't want to gain weight, go ahead with the drug which wears टोपी. टोपी पहन के अच्छे काम करने वाला ड्रग. It wears टोपी and does all the holistic drug. तो इसको मैं बोलता भी हूँ, it's a very holistic drug actually. So which one is a holistic drug? That is टोपी पहनने वाला ड्रग. 5 important points about टोपी पहनने वाला ड्रग. वो क्या 5 बातें हैं इस टोपी पहनने वाले ड्रग के बारे में. सबसे पहली चीज़, anti-epileptic drug, point number 1. Bipolar disorder, point to be noted number 2. Craving of alcohol, that is point to be noted number 3. Prophylaxis of migraine, point to be noted number 4. And for bipolar disorder we have already told you, and they are also utilized for the prophylaxis of migraine and obesity. ठीक है, तो मल्टीपल कंडीशन में हम इसको यूज कर रहे हैं. पांचों बात हम एक बार देख लिए. Their side effect is weight loss. That is why they are an anti-obesity drug, anti-epileptic drug having anti-obesity property, Topiramate. ठीक है. They are also causing renal stone and development of the somnolence or excessive sedation. Somnolence is excessive sedation. So Topiramate के बारे में I think we are done here. Next drug जहाँ से बार बार क्वेश्चन आता है, that is known as your lithium. Lithium is one of the drug that is mainly utilized in mania, है ना. मैनिया में इसको यूज करते हैं, आपने पढ़ा भी होगा. Lithium is one of the drug that is acting by inhibiting IMPase, है ना, IMPase. Because of this they are going to decrease the secondary messengers that were mainly involved in the manic, है ना, मैनिक पाथवे, मैनिया पाथवे में जो इन्वॉल्व थे, या मैनिक न्यूरो पैथोफिजियोलॉजी में जो न्यूरोट्रांसमीटर इन्वॉल्व थे, डिक्रीजिंग द सेकेंडरी मैसेंजर्स. एंड व्हाट आर दोज सेकेंडरी मैसेंजर्स? IMPase. What are those secondary messenger? That is ultimately decreasing the IP3 and ultimately decreasing the DAG. IP3 and DAG के लेवल को कम करता है. ठीक है. So lithium is one of the drug that is considered the drug of choice for mania, drug of choice for prophylaxis of mania, है ना. मैनिया के लिए ड्रग ऑफ चॉइस, मैनिया के प्रोफिलैक्सिस के लिए ड्रग ऑफ चॉइस, एंड ड्रग ऑफ चॉइस फॉर एक्यूट अटैक. अगर एक्यूट अटैक हो जाए तो वी विल बी एडिंग सीडेटिव, बिकॉज द कंप्लीट एक्शन ऑफ लिथियम, द कंप्लीट ऑनसेट ऑफ एक्शन ऑफ लिथियम इज गोइंग टू टेक सम टाइम. इट इज गोइंग टू टेक एटलीस्ट मिनिमम 2 to 3 मिनिमम, ये लीस्ट है, ज़्यादा भी लग सकता है, minimum 2 to 3 weeks. So for the first 2 to 3 weeks we'll be adding sedatives like atypical antipsychotics or diazepam and lithium. After few weeks we are going to withdraw the sedative and we'll continue only the lithium. So lithium is a very very important drug, please do remember that one. It's a drug that is having narrow therapeutic index, therefore इसकी therapeutic drug monitoring is always and always required. कभी भी lithium देते हैं तो we always monitor the plasma concentration of lithium. The safer range of lithium is always going to be in the range of 0.6 to 1.5. अब इसमें सब कुछ आ जाएगा. 0.6 to 1.5 में there will be prophylaxis also, there will be acute attack also. Prophylactic में plasma concentration थोड़ा कम रहेगा, like 0.6 to 1. Acute attack में 1 to 1.5. Now this is according to Goodman-Gilman. In some textbook they have also given the range as 0.8 to 1.2. कहीं कहीं पे 0.6 to 1.2 भी दिया गया है, but again according to pharma and many other standard textbook this is the range is 0.6 to 1.5 that I am giving to all of you guys. अगर कहीं पे भी आपको 1.2 तक भी लिखवाया गया तो it's not wrong, because in some textbook it's given like that. Now remember, lithium is one of the drug. If you want to do therapeutic drug monitoring, sample you are going to collect at least 12 hours after the last dose. This is the time that is required to reach the trough plasma concentration. Peak plasma concentration एक होता है, एक होता है trough plasma concentration. To reach the trough plasma concentration it will take around 12 hours. So sample will be collected at least around 12 hours. And sample is, or you are going to start the TDM. एक और point note कर लीजिए इसमें कि when will you start TDM? TDM is going to be started at least 10 days after starting the lithium. 10 days after starting lithium. ऐसा नहीं कि आज स्टार्ट किया और कल से आपने TDM स्टार्ट कर दिया. TDM में करते क्या है? You are actually going to monitor the plasma concentration of that drug. ठीक है? So that is going to be your lithium. Now toxic plasma concentration is any level that is going beyond 1.5. For example, at around 2 you require let's say dialysis. So you require admission. 3 पे you require dialysis. 3.2 पे there will be permanent neurological symptom, permanent neurological damage as well, and death can occur around 4.2. ठीक है. Remember dialysis जो word यहाँ पे लिखा गया ना, अगर lithium की toxicity होती है, if ever there is a lithium toxicity that is going to be seen, the treatment will be mainly hemodialysis only. हीमोडायलिसिस। सो एक एग्जामिनर में क्वेश्चन पूछा कि हीमोडायलिसिस इनएफेक्टिव इन लिथियम टॉक्सिसिटी, दैट वाज अ फॉल्स स्टेटमेंट, इट्स हाईली एंड डेफिनेटली इफेक्टिव, रिमेंबर दैट. Lithium is one of the drug that is going to be associated with many side effects. You can remember all the side effects with the simple mnemonic of LITTH, lith. That is going to be leukocytosis, diabetes insipidus, tremor, teratogenic and hypothyroidism. Teratogenicity में they will be causing Epstein anomaly, इसको एक और teratogenic effect बोलते हैं floppy baby syndrome, है ना. Epstein anomaly का चेस्ट एक्सरे करते हैं तो आपको रेडियो में पढ़ाते भी हैं, बॉक्स शेप हार्ट आपको मिलता है, ठीक है. So because they are associated with the teratogenic effect, remember they should be avoided in pregnancy, especially in the first trimester. Epstein anomaly or floppy baby syndrome में patient is going to present with the neonatal goiter because they are causing hypothyroidism. If they are causing hypothyroidism, they can even cause hypothyroidism in the neonate as well. They can cross the blood placental barrier, they can cause neonatal goiter, CNS depression, hypotonic and cardiac murmur because of this cardiac defect that they are going to actually cause. ठीक है. Alright, so we have leukocytosis, we are having insipidus, diabetes insipidus, we are having tremor as a side effect, teratogenicity, hypothyroidism. Hypothyroidism में they will be increasing TSH and decreasing the T3 level. ठीक है. So these are the important side effect. Drug interaction of the lithium with any diuretics like thiazide and potassium sparing diuretics and loop diuretics. Thiazide, potassium sparing and loop diuretics, they are actually going to decrease the renal clearance of lithium and they will increase the risk of lithium toxicity. Diuretics like osmotic, they will increase the renal clearance of lithium. NSAIDs, they are also going to increase the lithium reabsorption and increase the serum concentration. That means NSAID can increase, NSAID and lisinopril, they both can increase the lithium toxicity. Now with the diuretics, why there is increase in the risk of lithium toxicity, थोड़ा सा ध्यान दीजिएगा. रीज़न ये है कि whenever we are going to give a diuretics, diuretics will be always and always causing natriuresis. Diuresis is going to cause your natriuresis and natriuresis की वजह से there will be decrease in the sodium level, decrease in the serum sodium. Serum sodium कम होगा, so there is actually going to be compensatory increase in sodium reabsorption. और आपको पता है कि बॉडी में lithium and sodium is getting absorbed and reabsorbed through the same, because they are coming from the same family in the periodic table. If you remember, lithium, sodium, they are coming from the same. Remember, lithium will be utilizing the same channel for the one that is utilized by the sodium. So there is a compensatory increase in the sodium reabsorption along with the lithium, and therefore they will actually increase the risk of lithium toxicity. That is actually increasing the risk of lithium toxicity का रिस्क को ये बढ़ा देता है, ठीक है. सो लिथियम टॉक्सिसिटी के ट्रीटमेंट में वी आर गोइंग टू यूटिलाइज अ ड्रग. The name of the compound that we can utilize in lithium toxicity, the treatment modality is going to be dialysis. ठीक है. Diuretics can increase the risk of toxicity. That is also one of the important problem that we have already understood. It's available as tablet, carpal tunnel. Okay. नाउ एंटीसाइकोटिक्स एक और ड्रग जो इम्पॉर्टेंट है, हमेशा ध्यान रखिएगा. इसमें दो क्लास में डिवाइड किया गया. वन इज कॉल्ड योर टिपिकल एंटीसाइकोटिक्स दैट इज D2 ब्लॉकर. अदर वन इज कॉल्ड योर एटिपिकल एंटीसाइकोटिक्स दैट इज योर 5-HT2A ब्लॉकर. एटिपिकल एंटीसाइकोटिक्स दैट इज गोइंग टू बी योर 5-HT2A ब्लॉकर. टिपिकल एंटीसाइकोटिक्स are D2 blocker. The drugs that we are having in this one are going to be drugs like your haloperidol, droperidol, ठीक है, flupentixol, zuclopentixol, ठीक है, flupentixol, zuclopentixol. Chlorpromazine, thioridazine. Chlorpromazine actually is a very low potency drug. Thioridazine तो आजकल यूज नहीं करते हैं क्लिनिकली. Thioridazine, they are causing retinal deposits and also sudden cardiac death has also been reported with the thioridazine. ठीक है. Haloperidol, ऊपर वाले जितने भी हैं ये सारे के सारे हाई पोटेंसी ड्रग हैं. दीज आर एक्चुअली लो पोटेंसी ड्रग. इसको बोलते हैं लीस्ट पोटेंट. एलपी मतलब लो पोटेंसी एंड लीस्ट पोटेंट इज गोइंग टू बी थायरोडाजिन. Atypical antipsychotics. What are the atypical antipsychotics? These are going to be drugs like your risperidone. Risperidone overall is considered the most potent atypical. Most potent atypical. है ना. We have drugs like your quetiapine. Drugs like your aripiprazole. Ziprasidone. Aripiprazole, other one is called your ziprasidone. Although all the atypicals are mainly causing metabolic side effect and weight gain, aripiprazole and ziprasidone, they are actually in MCQs because they are having least weight gain और metabolic side effect. Remember, तो इसको बोलते हैं अरे शिप्रा को देखा, शिप्रा इज नॉट गेनिंग वेट, शिप्रा इज वेरी स्लिम शॉर्ट, अरे शिप्रा को देखा, अरे अरिपिप्राजोल एंड जिप्रासिडोन. Then we are having other compounds like clozapine, olanzapine. Clozapine is the drug of choice in a patient with the resistant psychosis. Clozapine is the drug of choice in a patient with the resistant psychosis. Olanzapine is also one of the drugs that can be utilized in psychosis. As a matter of fact, remember olanzapine, risperidone, they are the very commonly utilized atypical antipsychotics. So atypical antipsychotics, mainly 5-HT2A blocker, they are having some other properties as well. Mainly D2 blocker is going to be typical. Now most of the typical that we are having, if you are going to see, typicals are mainly associated with side effect called your extrapyramidal symptom. हाइपरप्रोलैक्टिनीमिया. एक्स्ट्रापिरामिडल सिम्टम हाइपरप्रोलैक्टिनीमिया. एग्जाम में पूछा किस वजह से आएगा. सो रिमेंबर एक्स्ट्रापिरामिडल सिम्टम इज मेनली सीन ड्यू टू द ब्लॉकेड ऑफ D2 blockade in the nigrostriatal pathway. Mainly seen due to D2 blockade in the nigrostriatal pathway. D2 blockade in the nigrostriatal pathway. ठीक है. Mainly seen due to D2 blockade in nigrostriatal pathway. Hyperprolactinemia. Prolactin level is high. ठीक है. Hyperprolactinemia. Prolactin level is going to be high. Because normally remember dopamine actually have inhibitory effect on the prolactin. और टिपिकल में मेनली हम किस तरह का ड्रग देना है, वी आर गिविंग D2 ब्लॉकर. सो दे विल बी इंक्रीजिंग द, अगर D2 को ब्लॉक कर दिया, डोपामीन को ब्लॉक कर दिया, तो डोपामीन का प्रोलैक्टिन के ऊपर इनहिबिटरी इफेक्ट विल बी गॉन एंड देयर विल बी इंक्रीज इन द लेवल ऑफ प्रोलैक्टिन. हाइपर प्रोलैक्टिनीमिया इज वन ऑफ द इंपॉर्टेंट साइड इफेक्ट. अदर साइड इफेक्ट दैट दे कैन कॉज विल बी योर sedation is another side effect that can be caused by this typical antipsychotics. Typical antipsychotics will have many side effects, है ना. Some of these have been mentioned here. Atypical antipsychotics की अगर बात करें तो among atypicals they are mainly associated with side effect metabolic abnormality या metabolic side effect. Metabolic side effect are going to be your weight gain, insulin resistance, ठीक है, dyslipidemia, डायबिटीज मेलाइटिस, ठीक है. These are important drugs that are causing metabolic side effect, and this metabolic side effect that we are having is maximally associated with the drug that is going to give you a zero figure like olanzapine, quetiapine, again zero figure, जैसे देख लीजिए O है zero figure, circular बना दिया, quetiapine again, और clozapine, the one that we have here, they are the most important side effect. Clozapine के बारे में मैं आपको कुछ और बातें बता दूं, that clozapine is one of the drug that is a drug of choice in resistant psychosis. Resistant psychosis किसको बोलते हैं? psychosis that is non-responsive to at least 2 or more than 2 antipsychotics at the optimal dosage, है ना. तो resistant psychosis में we can use clozapine. It is considered the first anti-suicidal drug. So in one of the examiner they asked the examiner asked the clozapine increase the risk of suicide. No, they are the anti-suicidal drug. It's one of the first anti-suicidal drug. Clozapine is one of the drugs that is associated with some specific side effect. In addition to the metabolic syndrome, they are associated with a specific side effect like agranulocytosis. Now this agranulocytosis is a dangerous kind of side effect that require usually monitoring. Agranulocytosis actually it is going to require the monitoring of the drugs. ठीक है. agranulocytosis, साइलोरिया जिसको हम बोलते हैं वेट पिलो सिंड्रोम, साइलोरिया विच वी कॉल्ड एज अ वेट पिलो सिंड्रोम, एक्सेसिव सेलिवेशन जिसकी वजह से होता है, एक्सेसिव सेलिवेशन, साइलोरिया, sedation, seizure, and they are also been associated with your myocarditis, also associated with a side effect called your myocarditis. So these are the important side effect that has been associated specifically with the clozapine, and baki most of the atypical antipsychotics they are associated with the metabolic side effect. अब एक है जैसे मान लीजिए क्यूटियापिन है, तो क्यूटियापिन इज वन ऑफ द एटिपिकल एंटीसाइकोटिक्स. मेटाबॉलिक तो करेगा लेकिन क्यूटियापिन इट इज ऑल्सो एसोसिएटेड विद योर कैटरैक्ट. तो इसको मैं बोलता हूँ एक ऐसी रानी थी जिसको दिखाई नहीं देता था, अंधी रानी, क्वीन को कैटरैक्ट था, अंधी रानी. ठीक है. क्यूटियापिन कैटरैक्ट, क्यूटियापिन इज एसोसिएटेड विद द कैटरैक्ट. ठीक है. मैक्सिमम रिस्क ऑफ एक्स्ट्रा पिरामिडल सिम्टम, अगर मैं इसको इमीडिएटली समराइज कर दूँ, सो दिस विल बी मेनली कॉज बाय योर टिपिकल एज कंपेयर टू एटिपिकल. एटिपिकल के साथ एक्स्ट्रा पिरामिडल सिम्टम नहीं है. टिपिकल में इट इज मेनली गोइंग टू बी योर हेलोपेरिडोल and least associated with your chlorpromazine and THZ I am writing for thyroidazine. CPZ the full name I have written in the previous slide, chlorpromazine, thyroidazine. मैं उल्टा लिख दिया. क्लोरप्रोमाजिन तो क्लिनिकली यूज होता है अनडाउटेडली, बट सबसे जो ज़्यादा पोटेंट, सबसे लीस्ट पोटेंट दैट वी हैव इज कॉल्ड थायरोडाजिन. सो थायरोडाजिन के साथ ऑलवेज एंड ऑलवेज देयर विल बी लेसर रिस्क ऑफ, with the thyroidazine there will be lesser risk of extrapyramidal symptom. ठीक है. Atypical is not supposed to cause, but there is a risky drug in the atypical, और उस risky drug का नाम है risperidone. So among atypical सबसे ज़्यादा जो risk करता है extrapyramidal symptom का, we call it as a risperidone. So I repeat, atypicals are not supposed to cause metabolic syndrome, not supposed to cause extrapyramidal symptom, but there is one risperidone which is also causing extrapyramidal symptom same as the typical. इसीलिए मैं बोलता हूँ it's a very very risky drug. Risperidone, it's the most potent atypical. It's the most potent atypical. Least or no extrapyramidal symptom, it's always going to be clozapine. Clozapine, they have no extrapyramidal symptom or least extrapyramidal symptom overall among the entire antipsychotics. Atypical that can cause arrhythmia, we have many drugs that can cause, like your sertindol, ziprasidone, they have been associated with arrhythmia. Uses and side effect of clozapine I have already clarified and summarized to all of you guys. Earliest extrapyramidal symptom they are going to be your dystonia. एक और D2 ब्लॉकर है जिससे बार बार क्वेश्चन आता है, इसको बोलते हैं मेटोक्लोप्रामाइड. Metoclopramide, it's one of the D2 blocker. It's actually not an antipsychotic, it's a prokinetic agent. But because it's a D2 blocker, this metoclopramide actually crosses your blood-brain barrier. They are crossing your blood-brain barrier. And because lithium also has, yes doctor, lithium also has anti-suicidal property. That's right. Achan Khan, that's right. They are crossing blood-brain barrier and they can cross D2 blockade, you know, in your nigrostriatal pathway, and they are going to be associated with your extrapyramidal symptom like your dystonia. So which anti-epileptic, which anti-emetic drug can cause development of abnormal posture or extrapyramidal symptom? That is going to be metoclopramide. So इसके treatment के लिए extrapyramidal symptom can be caused by any of the typicals. Remember, not मेटोक्लोप्रामाइड इज जस्ट वन ड्रग, बट सारे टिपिकल कर सकते हैं एक्स्ट्रा प्रोनोट सिम्टम लाइक डिस्टोनिया. Because there is excessive blockade of D2, we have to balance it by giving centrally acting anticholinergic drug. The name of the compound is your benzhexol, benztropine, promethazine, है ना, benzhexol, benztropine, promethazine, ये सारे के सारे. Most common extrapyramidal symptom, this is going to be akathisia, motor restlessness without anxiety. Motor restlessness without anxiety, that is akathisia. Propranolol being the drug of choice. Dangerous one is going to be your neuroleptic malignant syndrome, where the patient will have high grade fever, autonomic instability with the blood pressure, myoglobinuria, increase in the creatinine kinase. ये सारे के सारे फीचर आएंगे. myoglobinuria, increase in the creatinine kinase. और इसके मैनेजमेंट के लिए we are going to utilize a specific antidote, that is bromocriptine. And one of the drug that we were using earlier, one of the agent that we were using earlier for the management, we are still adding that. The name of the compound is your dantrolene. Although dantrolene is the drug of choice for malignant hyperthermia, but they are also used in neuroleptic malignant syndrome. Least weight gain among atypical, that is एरिशिप्रा को देखा क्या, एरिपिप्राजोल, जिप्रासिडोन, एरिपिप्राजोल एंड जिप्रासिडोन. Aripiprazole, ziprasidone. Antipsychotic that is causing weight loss. Which antipsychotic is going to cause weight loss? तो एक है, इकलौता ड्रग है that has shown to cause weight loss is molindone, that is coming under the miscellaneous group of antipsychotics. Maximum hyperprolactinemia among atypical. So among atypical there is a risky drug. I told you the name of the compound is your risperidone. Risperidone या risperidone, जैसे करना याद कर लो. Corneal opacity, retinal pigmentation that has been reported with the thioridazine. Cataract is caused by your quetiapine. Andhi Rani. Quetiapine has been associated with the cataract. So this was a quick summary about our antipsychotics. तो ये antipsychotics भी हो गया. A patient on risperidone came to the emergency with fixed upper gaze. So fixed upper gaze आप देख सकते हैं, they are mainly talking about the dystonia or one of the extrapyramidal symptom. The treatment of this condition क्या करोगे? तो ये बहुत पहले से मैं पढ़ा रहा हूँ. इनफैक्ट अभी इस बारे के रिसेंट INICT में भी आया भी हुआ था ये. Clonazepam, metoclopramide, promethazine, haloperidol. See, haloperidol itself is a D2 blocker. They can further precipitate. So we are going to give promethazine. It's one of the antihistaminic having anticholinergic property. Promethazine is one of the antihistaminic having centrally acting anticholinergic property. That will be the drug of choice. आपका अपना एट्रोपिन भी बहुत फेवरेट है, स्पेशली विद द सीनियर एग्जामिनर. ड्रग लाइक एट्रोपिन, क्लोनिडीन कहीं ना कहीं से रहता ही है. समहाउ दिस ड्रग इज ऑन द टिप ऑफ टंग एंड दे ऑलवेज आस्क क्वेश्चन ऑन एट्रोपिन. रिमेंबर, एट्रोपिन इज वन ऑफ द ड्रग दैट इज डिराइव्ड फ्रॉम एट्रोपा बेलाडोना. थेराप्यूटिक डोज पे इसका CNS पे कोई इफेक्ट नहीं आता है, बट एट द हाई डोज दे कैन कॉज रेस्टलेसनेस, डेलीरियम एंड दे कैन इवन लीड टू कोलैप्स. They are the drug of choice in organophosphate poisoning. They are also the drug of choice in carbamate poisoning, CB, carbamate poisoning. CB को मैंने carbamate लिख दिया. Mushroom poisoning, ठीक है. Contraindication of atropine hyoscine. Contraindication क्या होगा? Angle closure glaucoma. Why? Because atropine as a drug, they themselves causes a mydriasis. So एक rule आपको पता है, any drug that causes mydriasis, they can precipitate glaucoma. If a drug is causing miosis, can be used in glaucoma. I repeat, if a drug is causing mydriasis, they will interfere with the aqueous outflow, they can precipitate. BPH में नहीं देंगे because again they are anticholinergic drug. They will cause increase in the risk of urine retention, and any known case of urine retention अगर है तो उसमें भी नहीं देंगे. Atropine is also not given in the child because there will be increase in the risk of atropine fever. Atropine is anticholinergic drug, उसके साथ atropine fever का रिस्क ज़्यादा होता है. अगर atropine की toxicity हो जाए तो we can utilize the agent that is physostigmine. तो atropine toxicity का symptom क्या होगा? What will be the symptom? What is the presentation? So remember, atropine is a non-selective muscarinic antagonist. I ask you to just look at the 3 points. Look at the eyes. There will be mydriasis. Look at the body temperature, increase in the body temperature. Look at the heart rate, there will be increase in the heart rate. तो आप just start looking from the eyes. Eyes never lies. एंड एट्रोपिन में एवरीथिंग विल बी ऑन द टॉप. एटोपिन, pupil size on top, that is mydriasis. Body temperature is on top. Now body temperature is on the top because there is a decrease in the secretion, remember that. So secretion कम है इसीलिए body temperature बढ़ जाता है and there will be tachycardia. So atropine, atropine को बोलिए क्या, atopine, remember that. ठीक है. There are some anticholinergic that is working in the eye, anticholinergics in eye, और इनको मैं बोलता हूँ कि atropine is one of the drug. Overall, you can remember all these drugs by the simple mnemonic ऐश्वर्या के eye की CT. ऐश्वर्या has a very beautiful eye, and if you want to know the beauty of the eye, you can do a CT scan. ऐश्वर्या के eye की CT. Now, why I am saying ऐश्वर्या के eye की CT? Because these drugs have been plotted according to their T half life. Like atropine has the longest one, 7 to 10. In some ophthalmology textbook, it's also written up to 2 weeks. Scopolamine, homatropine, cyclopentolate, tropicamide. So preferred cycloplegic pediatric in pediatric 0 to 7 0 to 7 is going to be ointment, 1% ointment. And adults में we are going to prefer cycloplegic agent in adult is going to be tropicamide. अगर tropicamide option में नहीं है तो we are going to use cyclopentolate. Tropicamide is much milder. In adults we require milder because ciliary muscle tone in adults is weaker as compared to pediatrics. Pediatrics बच्चों में ciliary muscle tone is much stronger. So we need a very potent drug. ठीक है. Dr. Achan Khan, that's definitely yes. That's a definite yes. Okay. Atropine can be utilized in condition like physostigmine poisoning का drug of choice, organophosphate poisoning, carbamate poisoning, sinus bradycardia और sick sinus syndrome, heart block partial or complete, vasovagal shock में, in acute iridocyclitis for acute pain. So in सारे ही condition में atropine is the drug of choice. So atropine is a very broad spectrum drug actually used in many condition. Head to toe में जाओगे तो कई जगह पे यूज करते हैं. In fact, along with the opioid, we are also utilizing, है ना, along with the opioids. We are utilizing in non-infective diarrhea. They will decrease the risk of opioid abuse, and as a pre-anesthetic agent, they will decrease the secretion. तो इसीलिए इसको यूज़ कर सकते हैं, बट आजकल इसको नहीं यूज़ करते हैं बिकॉज एट्रोपिन, एज आई टोल्ड यू, इट कैन इंक्रीज द रिस्क ऑफ पोस्ट ऑफ साइकोसिस. तो कई पेशेंट में पोस्ट ऑफ साइकोसिस का देखा गया, इसलिए इसको आजकल नहीं यूज़ करते. तो एंटीकोलिनर्जिक ड्रग दैट इज मेनली यूटिलाइज एज अ pre-anesthetic drug is mainly your glycopyrrolate. Glycopyrrolate, if you have heard about glycopyrrolate, it's one of the anticholinergic drug as well. Glycopyrrolate, it's one of the anticholinergic drug that is utilized a pre-anesthetic drug because of its pre-anesthetic drug. Now this is utilized a pre-anesthetic drug. Glycopyrrolate is mainly going to be utilized a pre-anesthetic drug because of its quaternary amine character. They do not cross the blood-brain barrier. अगला drug Clonidine. Remember Clonidine is one of the alpha-2 agonist. They decrease or inhibit the noradrenaline release from the presynaptic neuron. So mainly they are centrally acting anticholinergic drug. Therefore they can be utilized in hypertension, off-level Tourette syndrome में, opioid withdrawal syndrome में, diabetic diarrhea का तो drug of choice है. In pain like prophylaxis of migraine, postmenopausal hot flushes में, smoking cessation में they are one of the second line drug. So Clonidine का uses currently in the era of social media or in the era of Instagram, we all want to use our hot DPs को यूज़ करना है. हाइपरटेंशन, ओपियोइड विड्रॉल सिंड्रोम, टाउरेट सिंड्रोम, डायबिटिक डायरिया, पेन मैनेजमेंट में यूज़ कर सकते हैं, postmenopausal hot flushes, and also in the smoking cessation. So Clonidine is one of the drug that can be having multiple uses again, and their important side effect that you have to remember is rebound hypertension. और क्लोनिडीन मीडिएटेड रिबाउंड हाइपरटेंशन का जो इम्पॉर्टेंट ड्रग है, इसके लिए जो मैनेजमेंट होता है दैट इज गोइंग टू बी योर फेंटोलामीन. फेंटोलामीन, रिमेंबर गाइस, इट्स अ नॉन सेलेक्टिव अल्फा ब्लॉकर. ठीक है. एक और ड्रग है जो हम डिस्कस कर रहे थे, लाइडोकेन. इट इज़ वन ऑफ द क्लास 1B एंटी एरिथमिक ड्रग. लाइक टू फोन मी इसका नेमोनिक है. अगर आपने कभी मेरी एरिथमिया का रील या वीडियो या एरिथमिया का लेक्चर देखा है तो वहाँ मैं बताता हूँ, लाइक टू फोन मी, क्लास 1B. दे आर द ब्रेव ग्रुप ऑफ पीपल. लाइडोकेन, टोकेनाइड, फोन इज फेनिटोइन एंड मी इज मैक्सिलिटीन. They are the drug of choice in ventricular tachycardia and also the digoxin induced ventricular arrhythmia. They are the drug of choice. ठीक है. Their important side effect is because of their high lipid solubility, they will be crossing CNS toxicity first. So CNS toxicity will be faster as compared to cardiotoxic events like paresthesia, lightheadedness, slurred speech, है ना, convulsion. They can even lead to coma, comatose, है ना, ये सब करा सकते हैं. Hearing disturbances, tremor, tinnitus, ये सारे साइड इफेक्ट इट कैन एक्चुअली कॉज. लाइडोकेन. सो एग्जामिनर क्वेश्चन कैसे पूछा, अ पेशेंट वॉज गिवन अ एंटी अरिथमिक ड्रग ड्यू इन emergency room and after some time he developed paresthesia, slurred speech, convulsion and tremor, tinnitus. What is the anti arrhythmic drug he was possibly given? So lidocaine is one of the 1B anti arrhythmic drug. एरिथमिया की बात करें और एमायोड्रोन से क्वेश्चन ना है, ऐसे पॉसिबल नहीं है. इट्स अ ब्रॉड स्पेक्ट्रम एंटी एरिथमिक ड्रग दैट इज हैविंग मल्टीपल यूसेज, है ना, एंड दे आर ऑफन कंसिडर्ड द ड्रग ऑफ चॉइस इन रेजिस्टेंट एरिथमिया. दे आर एक्चुअली हैविंग ऑल 4 प्रॉपर्टी. व्हेन आई से ऑल 4 प्रॉपर्टी, सोडियम ब्लॉकेड, बीटा ब्लॉकेड, potassium blockade and also having calcium blockade, because on the potassium the action is more predominant. That is why we have classified them in the class 3 antiarrhythmic drug. Amiodarone is one of the class 3 antiarrhythmic drug. Okay, they are mainly utilized as a preferred drug in resistant cases of the arrhythmia. There is a problem with amiodarone. Look at the name. The name itself contain iodine. So excessive iodine can lead to hyperthyroidism. Plus prolonged usage of amiodarone, they have peripheral T4 to T3 inhibiting property. They inhibit peripheral T4 to T3 conversion and therefore they can lead to hypothyroidism. So at one way they are going to cause hyperthyroidism and on the other hand they are causing hypothyroidism. So which of the following drug that always confuses the thyroid? That is going to be amiodarone. It always confuses thyroid. As a matter of fact, thyroid toxicity is the most common side effect of amiodarone. Amiodarone is considered as a drug that is considered as a drug of choice in resistant arrhythmia. They are also the drug of choice in MI patient with arrhythmia. अगर MI induced arrhythmia है, MI patient में arrhythmia हो रहा है, तो उसमें भी also they will be considered as a drug of choice. Remember, amiodarone class 3 antiarrhythmic drug. Now amiodarone is one of the drugs that is associated with many side effects like QT prolongation. Any potassium channel blocker can cause QT prolongation. Liver enzyme or hepatotoxicity. MSC, thyroid abnormality, they can lead to hypo or hyperthyroidism both. Photosensitivity, they can actually end up causing a condition known as blue man syndrome. Abnormal endocrine function. Abnormal endocrine से एक चीज तो आप समझ गए ना, thyroid abnormality that I also told you. Thyroid abnormality. Now this gynecomastia has been reported in few studies only. Reported in few studies. कुछ स्टडीज में gynecomastia as a side effect has been reported, but that's very very rare. तो अगर आपको एक रूल आउट करना है, एक कौन सा साइड इफेक्ट नहीं होगा कंपेयर टू ऑल 4, तो यू कैन फर्स्ट रूल आउट gynecomastia बिकॉज दैट्स वेरी वेरी रेयर. बट अगर इसके अलावा और भी कुछ है इन जो भी लिस्ट मैंने दिया है, देन यू कैन चेक आउट दोज ऑप्शंस एज वेल. लुकिंग एट द स्टडीज, gynecomastia is one of the very rare. Optic neuritis is also one of the rare side effect. Interstitial lung disease leading to pulmonary fibrosis and corneal microdeposits, है ना, pulmonary fibrosis. So what are the questions that has already been asked? Pulmonary fibrosis, corneal microdeposits, photosensitivity. The most common side effect is called thyroid abnormality. This question has already been asked. QT prolongation वाला question has already been asked. ठीक है. In one of the very recent examination they asked which of the following is not a side effect. तो उसमें rule of exclusion की वजह से हमने उसमें gynecomastia को रूल आउट किया था. तो gynecomastia को रूल आउट करने का रीजन मैंने बता दिया. इट्स वेरी वेरी रेयर साइड इफेक्ट, रिपोर्टेड ओनली इन फ्यू स्टडीज. So examiner पूछा what is the investigation, you will ask on the follow up. So we will be asking for the ECG. Why ECG? Because they are causing QT prolongation. LFT because they are causing hepatotoxicity. Why we are going to ask for pulmonary function test or HRCT in patient with the respiratory symptom. अगर patient को कोई respiratory symptom आ रहा है तो in that case scenario you can ask for HRCT or you can even ask for your spirometry if the patient is having some pulmonary symptom, then only. Alright, or thyroid function test also you can ask because they are thyroid abnormality causing drug. Alright, thyroid profile करा सकते हो या सीरम TSH करा सकते हो. सिर्फ TSH लेवल भी करा सकते हो. So these are the investigation that you are going to ask on follow up. तो पूछा which of the following investigation is least asked or least important in the patient who is on amiodarone. तो ऑप्शन में था ECG, LFT, TSH, CBC. तो CBC का कोई यहाँ पे रोल नहीं था. ठीक है. एक लास्ट ड्रग है दैट इज डिजॉक्सिन एंड आफ्टर दैट विल डू द इमेजेस एंड MCQ and then we'll be done. The digoxin is one of the drug that is sodium potassium ATPase inhibiting drug. Because of sodium potassium ATPase, there will be increase in the intracellular sodium that is not physiological, and because of that, there will be causing a reversal of NCX. Because NCX is the only channel on the surface in our body that is having bimodal activity. जहाँ जैसे ज़रूरत है NCX will change its direction. तो NCX को एक्टिविटी को ये रिवर्स कर देगा, दैट इज गोइंग टू पंप आउट सोडियम एंड टेक इन कैल्शियम. एक्सेसिव कैल्शियम इनसाइड इज गोइंग टू इंक्रीज द फोर्स ऑफ कॉन्ट्रैक्शन, बिकॉज वी नो फॉर श्योर दैट फोर्स ऑफ कॉन्ट्रैक्शन इज डायरेक्टली प्रोपोर्शनल टू इंट्रासेलुलर कैल्शियम. व्हाट इज FOC? FOC मतलब फोर्स ऑफ कॉन्ट्रैक्शन. दिस ड्रग digoxin is a drug that I am discussing for all of you guys. Digoxin is a drug that I am discussing. It's also one of the drug having narrow therapeutic index, and because of that, इसका भी therapeutic plasma therapeutic drug monitoring is required. One additional property of this digoxin that we know, they are having additional vagomimetic activity. They are having vagomimetic activity at the nodal tissue, and because of vagomimetic activity at the nodal tissue, they are going to cause a decrement in the heart rate. ये क्या करते हैं? heart rate को कम कर देते हैं, है ना. So they are having positive inotropic, that means force of contraction को बढ़ाते हैं and heart rate को कम करते हैं. Force of contraction it will be increased and heart rate is going to be decreased. ठीक है. Digoxin is one of the drug. In any cases of hypokalemia, the risk of toxicity will increase, because hypokalemia में digoxin binding with the sodium potassium ATPase is going to increase. Hypercalcemia, there will be increase in the risk of arrhythmia. In a patient with thyrotoxicosis, renal failure, WPW syndrome, MI or partial or complete heart block में digoxin should not be given. So remember digoxin का contraindication, some condition you can remember by the mnemonic TRMP, Trump, high Trump. हाई ट्रम्प को याद करने का सिंपल तरीका है हाइपोकैलेमिया, हाइपोमैग्नीसीमिया बट हाइपरकैल्सीमिया. हाइपोकैलेमिया, हाइपोमैग्नीसीमिया बट हाइपरकैल्सीमिया. ठीक है. थायरोटॉक्सिकोसिस, रीनल फेलियर, बिकॉज डिजॉक्सिन इज मेनली एक्सक्रीटेड बाय द रीनल रूट. रीनल फेलियर में देयर विल बी इंक्रीज इन द रिस्क ऑफ डिजॉक्सिन टॉक्सिसिटी, इसलिए रीनल फेलियर में डिजॉक्सिन को नहीं देंगे. WPW सिंड्रोम में, नाउ इन द WPW सिंड्रोम अगेन देयर विल बी इंक्रीज इन द रिस्क ऑफ एरिथमिया. व्हाई? Because in WPW syndrome there is a bundle of Kent, there is an accessory pathway that will be overactive, because there is at the nodal tissue there is actually going to be increase in the vagal tone. That is one of the mechanism of action I told you here, increasing the vagal tone. So because there is a vagal tone, remember there is a condition called WPW syndrome. तो उसमें क्या होता है, एक accessory pathway ऐसे होता है, इसको हम बोलते हैं bundle of Kent. So this bundle of Kent, अगर मान लीजिए अपने फायरिंग, इफ द नॉर्मल फायरिंग स्पीड यू आर गोइंग टू इंटरफेयर, ये नॉर्मल हो गया, SA नोड टू AB नोड, देन देयर इज गोइंग टू बी बंडल ऑफ हिज, है ना, परकिंजे फाइबर फॉलोड बाय दैट. तो दिस इज गोइंग टू बी द नॉर्मल पाथवे. बट if you are going to inhibit the nodal tissue, because nodal tissue पे already there is AV nodal delay, and if you are going to give a drug that is further going to slow down the firing from the nodal tissue, then automatically this will be more predominant. ये आगे नहीं बढ़ेगा और ये automatically more predominant हो जाएगा. ठीक है. So in a patient with the WPW syndrome, there will be increase in the risk of arrhythmia due to accessory pathway that is present called bundle of Kent. MI patients में we are not going to give, there will be increase in the risk of arrhythmia. Partial और complete heart block में भी हम इसको नहीं देंगे. The drug that is very commonly utilized is actually going to be olanzapine. So olanzapine is the one that is mostly reported with the weight gain. Clozapine को उतना commonly use नहीं करते हैं, they are mainly utilized in resistant cases. लेकिन अगर risk wise देखा जाए, for example if you are going to do a study on animals, 10 animal को Clozapine, 10 animal को olanzapine देते हैं, तो Clozapine ज़्यादा weight gain करेगा compared to olanzapine. लेकिन रिपोर्टेड किसके साथ ज़्यादा है वो आपको समझना पड़ेगा, olanzapine, because olanzapine is very commonly utilized atypical antipsychotic. Clozapine is only utilized in the resistant cases. Making sense? तो मैक्सिमम जो रिपोर्टेड आपके पास है दैट इज मेनली विद द ओलांजापिन. बट दोनों ही ओलांजापिन, क्लोजापिन, है ना, दोनों ही वेट गेन करा सकते हैं. कई जगह पे बोला गया सिमिलर कराते हैं, कई जगह बोला गया क्लोजापिन ज़्यादा कराते हैं थोड़ा कंपेयर टू ओलांजापिन. डॉक्टर सुखबीर सिंह. ठीक है. Important side effect, remember the most common side effect overall is going to be nausea and vomiting, and a specific side effect is going to be xanthopsia, that is yellow vision. Xanthopsia is the specific side effect. डिजॉक्सिन इंड्यूस एरिथमिया के लिए ड्रग ऑफ चॉइस इज गोइंग टू बी लाइडोकेन. एग्जामिनर पूछा डिजॉक्सिन इंड्यूस एरिथमिया के लिए और क्या यूज कर सकते हैं, तो अदर एजेंट दैट वी कैन यूज फॉर डिजॉक्सिन इंड्यूस एरिथमिया कैन बी योर फेनिटोइन. Lidocaine undoubtedly is the drug of choice. Other drug that we can use is phenytoin. We can also utilize potassium. Potassium भी use कर सकते हैं. We can also utilize magnesium. Magnesium sulfate can also be utilized, है ना, for deoxy-induced arrhythmia. Severe toxicity में we are going to mainly use digibind. That is the fab fragment of the digoxin that is going to chelate the digoxin. Digibind is mainly for the severe toxicity. ठीक. डिजॉक्सिन इंड्यूस एरिथमिया के लिए लाइडोकेन, फेनिटोइन. पोटेशियम भी यूज कर सकते हैं बिकॉज पोटेशियम ऑलवेज इंटरफेयर विद द डिजॉक्सिन बाइंडिंग विद सोडियम पोटेशियम एटीपीएस. These drugs that can increase the risk of digoxin toxicity because diuretics, they will be causing hypokalemia. Erythromycin, verapamil, amiodarone, they are potent enzyme inhibitors. Corticosteroid, tetracycline, they are going to interfere with the digoxin binding with the binding protein. They are going to interfere with digoxin with its binding protein. ठीक है. Digoxin is a drug that is having very high volume distribution. Remember, they are having high volume distribution. Because of the high volume distribution, the T half-life is roughly around 40 hours. Very, very important. ठीक है. Quinidine, they also inhibit the excretion, and therefore these are the drugs that you can remember. 𝐒𝐿, are the drug that can actually increase the risk of digoxin toxicity. They can actually increase the risk of digoxin toxicity. So this was everything. I think top 10 drugs के बारे में तो मैंने heading डाला था, but we have covered more than 10 drugs. We have covered more than 10 drugs. Now last के 15-20 minutes का lecture will be mainly talking about the top 10 images. Although these images we have covered somewhere, but top 10 image क्या क्या आ सकते हैं आपके एग्जाम में वो हम कवर करने जा रहे हैं. Look at this image, a patient from Bihar with the shown condition. So multiple hypopigmented patches you can see. Dermatologist ने diagnose भी कर दिया. It's a case of leprosy. Which of the following is true about if this is a case of multibacilli? I think multibacilli लिखने की भी जरूरत नहीं है because you can count there will be multiple 1, 2, 3, 4, 5, 6. तो 5 से definitely ज़्यादा है. So be it a case of paucibacillary or multibacillary, paucibacillary and multibacillary, the therapy is going to be same. The only thing that varies is the duration. Paucibacilli for 6 months, multibacilli for 12 months. The therapy for pauci and multibacilli, they are going to be same. That is going to be, the therapy is going to be same. That is rifampicin, clofazimine and dapsone. These are the 3 drugs usually. Rifampicin and rifampicin day 1 पे कैसे देते हैं, इसको देते हैं 600 मिलीग्राम supervised dose. SD means supervised dose. Clofazimine 300 milligram, again supervised dose. Dapsone 100 milligram on the daily basis. तो इसको भी day 1 में तीनों में से एक एक दे देते हैं. This will be given on day 1. You are going to give this on day 1. Then after day 2 onwards क्या patient लेगा? The drug strip will be given to the patients, and from that drug strip the patient will continue the dapsone 100 milligram per day. वो continue रहेगा 100 milligram per day, and clofazimine he will continue 50 milligram on the daily basis. The loading dose आपने दिया clofazimine का day 1 पे. After that you will be continuing only the, you are going to continue only the maintenance dose of clofazimine, that is around 50 milligram on the daily basis. ठीक है. Dr. Sukhbir, I think your query has been sorted. So if you are going to see here 2 drugs for 6 months, 3 drugs for 6 months, 3 drugs single dose, no, we don't have any single dose regimen now. 3 drugs for 12 months. तो multibacillary में तो I think we already know that is going to be 3 drugs for 12 months. Which of the following is true about the shown image? तो इसमें usually potency और efficacy पूछता है. Potency always go from left to right, है ना. तो इसको मैं बोलता हूँ take help from the help mnemonic whenever you forget this one. Height will be telling you efficacy, left वाला will be telling you about potency. Potency order में जाओगे तो B is going to be followed by A, then going to be C followed by D. Efficacy order में if you are going to see तो A, C and D तीनों का height is almost same. So A is equiefficacious to C, which is equiefficacious to D, and least is going to be your B. Least efficacious is going to be B. नाउ इफ यू आर गोइंग टू सी ड्रग्स लाइक ए सी एंड डी तीनों का अगर हाइट एक समान है, एक जैसा है, so they are actually showing a sign of a competitive inhibition. Competitive inhibition में same height can be achieved but at the high dose. Non competitive inhibitor में height नीचे हो जाता है, तो वो भी एक क्वेश्चन आता है बार बार, ठीक है. आई होप इट्स सॉर्टेड फॉर ऑल ऑफ यू गाइस. इसमें अगर देखा जाए potency of A is more than C, potency of A is more than C, yes that's a correct one. Potency of C same as D, नहीं, potency order is going like this, B A C D. B is least potent, B is the most potent. ऑप्शन ए ड्रग डी इज मोस्ट एफिकेशियस, नो, ए सी डी तीनों ऑल थ्री आर इक्वी एफिकेशियस, रिमेंबर, ठीक है. एंड पोटेंसी विल गेट अफेक्टेड यूजुअली बाई, पोटेंसी दैट वी नो, पोटेंसी विल गेट अफेक्टेड यूजुअली बाई कंपिटिटिव इनिबिटर. एंड कंपिटिटिव इनिबिटर कर क्या सकते हैं, कंपिटिटिव इनिबिटर दे विल एक्चुअली कॉज राइट शिफ्ट ऑफ द ग्राफ, rightward shift of the graph, and they will decrease the potency. Non-competitive inhibitor ये ग्राफ को नीचे ले आते हैं, डाउनवर्ड शिफ्ट ऑफ द ग्राफ, डाउनवर्ड शिफ्ट ऑफ द ग्राफ. Non-competitive inhibitor there will be downward shift, and non-competitive inhibitor they will decrease the efficacy. ये ग्राफ के efficacy को कम कर देते हैं. P for potency, P for power, efficacy Eiffel Tower. Eiffel Tower क्यों फेमस है, बिकॉज ऑफ इट्स हाइट. तो हाइट देखना है एफिकेसी में, और पोटेंसी में सिर्फ देखना है एक्स एक्सिस पे, है ना, लेफ्ट से राइट पोटेंसी विल गो. ट्रू अबाउट द शोन इमेज, सो दिस इज वन ऑफ द इमेज ऑफ द G protein coupled receptor. It is the fastest acting, no, fastest acting is mainly your ion channel receptor या ligand gated receptor, also known as ion channel receptor, no, fastest acting ion channel. Beta component of the receptor is the active one, no, alpha is the active one is the alpha, है ना. इसके तीन कंपोनेंट अगर आप देखोगे, अल्फा बीटा गामा, अल्फा इज द वन विच इज द एक्टिव वन, बीटा गामा आर गोइंग टू बी इनएक्टिव वन. And whenever there is a signal that is coming, let's say a ligand is going to bind here, after a ligand binding a signal will be generated, and inside what they are going to do, there is going to be dissociation. तो आप देखोगे ये जो इमेज सेकेंड वाला दिख रहा है, this is usually after binding, so there is a dissociation between alpha and beta gamma. तो upon activation the subunit breakdown, yes. अब इसमें तीन कंपोनेंट हैं. जो G अल्फा है, it is going to be further subdivided into three, G alpha S, G alpha I, and G alpha Q. The important point to be noted here, G alpha S I Q, S is mainly going to stimulate the enzyme adenylate cyclase, G alpha I is going to inhibit the enzyme adenylate cyclase, and G alpha Q, they are going to act by IP3 and DAG pathway. They are going to act by activating the secondary enzyme, that is phospholipase C activation, that will be increasing the secondary messenger like IP3 and diacyl DAG, ठीक है, IP3 and DAG. तो ये तीनों के सेकेंडरी जो मैसेंजर हैं लाइक एडेनाइल साइक्लेज का एक्टिवेशन विल एक्चुअली लीड टू इंक्रीज इन द ATP ब्रेकडाउन टू साइक्लिक AMP. तो साइक्लिक AMP लेवल क्या हो जाएगा, बढ़ जाएगा. यहाँ पे साइक्लिक AMP लेवल इज एक्चुअली गोइंग टू बी डिक्रीज, ठीक है, एंड IP3 DAG यहाँ बढ़ेगा, ठीक है, इन द GQ. Read about G protein coupled receptor, very very important. A shown side effect is by given drug, which drug will be causing. So you can see hypertrichosis, eyelashes बढ़ गए हैं. This will be mainly caused by your PGF2 alpha analog. PGF2 alpha analog. So we have only one, that is going to be bimatoprost. So they are going to cause some important side effect. PGF2 alpha analog, they will be causing pigmentation of iris. You must have heard about this pigmentation of iris, that is heterochromia iridis, है ना, heterochromia iridis या hyperchromic iris. Then they are also going to cause growth of eyelashes, foreign body sensation, fat atrophy of the orbit. Orbit के fat atrophy की वजह से there will be enophthalmos, and a fat atrophy of the orbit leading to enophthalmos, and they can even lead to your acute anterior uveitis. So they are going to be your PGF2 alpha. So they are going to be bimatoprost. Bimatoprost is one of the PGF2 alpha, ठीक है. The shown side effect, ये मैं कितने दिनों से आप PYQ के मेरे पुराने इमेज बेस देखोगे तो ये क्वेश्चन मैं बार बार पूछता हूँ कैंसर में, और ये क्वेश्चन इस बार FMG 2024 जनवरी में आया भी हुआ था। तो दिस इज एक्चुअली a केस ऑफ हैंड एंड फुट सिंड्रोम. हैंड एंड फुट सिंड्रोम इज कॉज बाय 3 इंपॉर्टेंट ड्रग. वन इज कॉल्ड योर 5-fluorouracil. तो बोलता हूँ कैसे याद करो, 5 हैंड्स में 5 फिंगर है. इसी का एक प्रो ड्रग है दैट इज कैपेसिटाबीन. वन प्रो ड्रग इज कॉल्ड कैपेसिटाबीन, एंड वन मोर ड्रग दैट इज नोन एज योर पेमेट्रेक्सेट. सो पेमेट्रेक्सेट है ना, दैट इज 5 पेमेट्रेक्सेट. सो दीज आर द ड्रग दैट इज कॉजिंग पेनफुल एरिथमेटस पाम एंड सोल, और इसको मैनेज करने के लिए वी कैन ऐड विटामिन B6 अलॉन्ग विद थेरेपी. तो कैपेसिटाबिन इज द करेक्ट आंसर, नॉट मीथोट्रेक्सेट और 6-mercaptopurine. ठीक है, इसका जवाब होगा कैपेसिटाबिन. आप लोग जवाब देते रहिए. 5-fluorouracil का प्रो ड्रग है कैपेसिटाबिन. ठीक है. Now this was a case of flagellate dermatitis. Flagellate dermatitis mainly going to be associated with which drug? सबसे पहले तो आपकी एम से पूछा था associated with which drug? Bleomycin. Now I am expecting कि अब अगले एग्जाम में क्वेश्चन पूछेगा कि why bleomycin क्यों कराता है? Because bleomycin is mainly getting metabolized by an enzyme called your hydrolase. Mainly getting metabolized by an enzyme hydrolase, and this hydrolase is an enzyme which is actually going to be absent in skin. They are actually absent in the skin, and therefore they will get deposited in the skin, leading to a thick bluish pigmentation, a grayish blue pigmentation. So name of the enzyme here is not caspase or synthase or elastase, it's a hydrolase enzyme. Okay? They are less present actually in the lungs. Therefore, bleomycin is also a drug that is associated with. Bleomycin is a drug because this hydrolase enzyme is less in the lungs. They also are associated with the pulmonary fibrosis. एक एग्जाम में तो ये भी पूछा कि इसके प्रिवेंशन के लिए क्या करोगे पल्मोनरी फाइब्रोसिस के लिए. तो वी हैव अ ड्रग कॉल्ड योर परफेनिडोन. एक टायरोसिन काइनेज इनहिबिटर भी है, निनटेडानिब. टायरोसिन काइनेज इनहिबिटर दैट इज निनटेडानिब. थोड़ा टेढ़ा नाम है बट याद कर सकते हैं आप लोग. अच्छा नाम ही टेढ़ा है, नाम में भी टेढ़ा है. निनटेडानिब. It's a tyrosine kinase inhibitor that will also slow down the progression of pulmonary fibrosis. Now this was one of the phosphodiesterase inhibitor that was approved for the shown condition. What is this shown condition? If you see silver scaly, look at the nails, है ना, silver scaly plaques या lesion. This is mainly a case of psoriasis. So which is one of the phosphodiesterase inhibitor that is approved for psoriasis? Roflumilast. Roflumilast is actually a drug that has got approved for COPD. Apremilast is the one. Apremilast that is going to decrease the inflammation. So they are having anti-inflammatory property. They are actually having anti-inflammatory property. Embrynon, inoximon, they are phosphodiesterase 3 inhibitor. Phosphodiesterase 3 inhibitor. इनको हम बोलते हैं inodilator. So this inodilator agent, they are mainly utilized in a patient with the congestive heart failure. We can use them in a patient with the congestive heart failure. All right. So these are the quick summary of phosphodiesterase inhibitor like Embrynon, Milrinone, and Inoximon. They are mainly utilized in a patient with the congestive heart failure. Apremilast, Roflumilast, they are the phosphodiesterase 4 inhibitor. इनके different uses हैं. Like Roflumilast is one of the agents that can be utilized in COPD and bronchial asthma. Apremilast is mainly approved for your psoriasis, psoriatic arthropathy. Psoriasis. Phosphodiesterase 5 inhibitor, sildenafil lasting for around 6 hours. Vardenafil also, tadalafil तैयार रखता है देर या लेट तक के लिए. So they are lasting for around 18 hours. They are the drug of choice for your erectile dysfunction. ये भी क्वेश्चन आया हुआ था इसलिए मैं बता रहा हूँ ये. विच इज द लॉन्गेस्ट एक्टिंग फॉस्फोडाइस्टेरेस 5 इनहिबिटर? टाडालाफिल तैयार रखता है देर या लेट तक के लिए. इरेक्टाइल डिसफंक्शन ड्रग ऑफ चॉइस है. प्लस इट कैन ऑल्सो यूटिलाइज इन अ पेशेंट विद द pulmonary hypertension. We can also utilize them in a pulmonary hypertension. All right. So this is your important phosphodiesterase 5 inhibitor. 3, 4, 5 को एक जगह मैंने summarize कर दिया. Important ones. The shown image is mainly utilized for. So this is actually OCUSERT. OCUSERT O के शेप में होता है. देखिएगा O के शेप में है ये. O के शेप में है. This is mainly going to contain your pilocarpine. ये क्या contain करता है? It mainly contains pilocarpine. ठीक है. तो ये है OCUSERT. लोअर आईलिड के नीचे रहेगा, इट विल कॉज कांस्टेंट रिलीज ऑफ द पाइलोकार्पिन दैट विल बी कॉजिंग मायोसिस. तो ग्लोकोमा में मेनली वी कैन यूटिलाइज फॉर द ट्रीटमेंट ऑफ द ग्लोकोमा, लाइक एंगल क्लोजर ग्लोकोमा वाले पेशेंट में हम इसको यूटिलाइज करते हैं. So this is actually containing pilocarpine, that is one of the M3 receptor agonist, है ना. तो ग्लोकोमा मेनली यूटिलाइज करते हैं. इसका नाम है ऑक्यूसर्ट, है ना, ऑक्यूसर्ट. तो एग्जाम में ये क्वेश्चन दिखा देगा, या तो फिंगर पे रखा रहेगा या आंख में लगा के रहेगा, डायरेक्टली पूछेगा क्या है ये. जैसे इस बार आया था ना एफएमजी में लिपिस लूप वाला आ गया था वो बीच में, वैसे इस तरह के क्वेश्चन आते हैं, बिकॉज दीज आर द न्यूअर रूट्स ऑफ ड्रग डिलीवरी. ऑलराइट, नाउ द शोन ड्रग्स, a diabetic patient was on this drug. This agent increases the tissue sensitivity. So what is this agent? Pioglitazone. Pioglitazone अगर देखोगे, so they are one of the PPAR gamma agonist. All the PPAR gamma agonists, they act mainly via nuclear receptor. And they actually increase the insulin sensitivity. Insulin sensitizing gene को ये बढ़ा देते हैं. They do not regulate adenylate cyclase or activate the GLUT2, inhibiting acid glucosidase, no. Regulating the transcription of gene, yes. They are increasing the transcription of gene, that is increasing the insulin sensitization, therefore glucose utilization क्या कर रही है, बढ़ा देते हैं. तो again this is just a matter of words, you can easily find it out. Pioglitazone, it is also one of the drug. Pioglitazone, it's also one of the drug. PO, कुछ भी पियोगे तो ब्लैडर में जाएगा. So they have actually been shown to be associated with increase in the risk of bladder cancer. इंक्रीज इन द रिस्क ऑफ ब्लैडर कैंसर. तो अगर किसी पेशेंट को हिस्ट्री ऑफ ब्लैडर कैंसर या फैमिली हिस्ट्री ऑफ ब्लैडर कैंसर है, वी शुड अवॉइड दिस वन. ठीक है. प्लस दे कैन इंक्रीज द सोडियम एंड वाटर रिटेंशन. बिकॉज ऑफ सोडियम एंड वाटर रिटेंशन दे कैन कॉज वेट गेन एंड दे शुड बी कॉन्ट्राइंडिकेटेड इन कंजेस्टिव हार्ट फेलियर पेशेंट्स. राइट, वेट गेन करा सकते हैं, दे विल बी कॉन्ट्राइंडिकेटेड इन कंजेस्टिव हार्ट फेलियर पेशेंट्स. ये वाला क्वेश्चन, गम हाइपरट्रॉफी. गम हाइपरट्रॉफी इज एक्चुअली अ कंडीशन दैट इज एसोसिएटेड विथ योर cyclosporine. Do you guys know that cyclosporine is one of the calcineurin inhibitor? It's one of the calcineurin inhibitor. Then one of the anti-epileptic drug like your phenytoin. Then calcium channel blocker like amlodipine has also been reported to have some gum hypertrophy as a side effect. Gum hypertrophy इसके साथ भी reported है. Among the given choices, I can go ahead with the phenytoin. If which drug is which patient is on antihypertensive drug and is also having history of epilepsy, which drug will cause the shown side effect? So that is going to be your phenytoin. I hope it is making sense to all of you guys. Now this drug, which drug is going to cause this problem? A known arrhythmic patient prophylactic therapy of arrhythmia was started on second line ATT. Okay, you were told to keep a check on the over ECG changes. Few weeks after ECG changes were noted as shown. तो आपको क्या दिख रहा है, एक जगह नॉर्मल QT और दूसरी जगह लॉन्ग QT. आई थिंक कहने की भी जरूरत नहीं है, नीचे इन्फॉर्मेशन भी दे दिया गया. तो पूछ रहा है विच एंटी ट्यूबरकुलर ड्रग विल कॉज QT प्रोलॉन्गेशन. सो QT प्रोलॉन्गेशन अमॉन्ग एंटी ट्यूबरकुलर ड्रग. नाउ यू हैव टू बी वेरी वेरी केयरफुल इन दिस क्वेश्चन. known arrhythmic patient on prophylactic therapy of arrhythmia was started. So he is already on anti-arrhythmic drug, वो भी ले रहा है. ठीक है. सेकेंड लाइन ATT स्टार्ट किया गया. Few weeks after ECG changes were noted, possible drug that could cause. So he is taking both arrhythmic, anti-arrhythmic भी ले रहा है और TB का भी ले रहा है. So bedaquiline, it's one of the ATP synthase inhibitor and they are known to cause arrhythmia, QT prolongation. जनवरी 2024 FMG एग्जाम क्वेश्चन एंड प्रीवियसली ये नीट पीजी का भी क्वेश्चन रहा है, आने वाले एग्जाम में पूछ सकता है. प्रीटोमेनिड, इट्स वन ऑफ द मेनिड वाला ड्रग दैट इज वन ऑफ द माइकोलिक एसिड सिंथेसिस इनहिबिटर. दे आर ऑल्सो एसोसिएटेड विद द QT प्रोलॉन्गेशन एज साइड इफेक्ट. एमायोड्रोन तो क्लास 3 एंटी एरिथमिक ड्रग है, ये तो QT प्रोलॉन्गेशन करेगा ही. सो करेक्ट आंसर फॉर दिस वन इज गोइंग टू बी ऑल ऑफ द अबव. ये नहीं पूछ रहा है कि विच एंटी एरिथमिक ड्रग विच कॉज QT प्रोलॉन्गेशन. इफ द क्वेश्चन वुड बी विच एंटी एरिथमिक ड्रग कॉज QT प्रोलॉन्गेशन, देन आंसर वुड बी एमायोड्रोन. Please remember, class 1A antiarrhythmic drug, they are mainly sodium blocker with the potassium channel blocker. They all can cause QT prolongation. They all can cause QT prolongation. For example, drugs like your quinidine, procainamide, disopyramide, they all can cause QT prolongation. Class 3 antiarrhythmic drug like amiodarone, sotalol, Sotalol is a beta blocker that is having potassium blocking property. So they all can cause QT prolongation because they are class 3. They are all potassium channel blocking drug. So all these drugs can cause QT prolongation. Okay. Now we are done here with the top 10 images as well. Now top 10 MCQs very quickly. A very new drug that I am expecting in this examination or maybe in upcoming examination. आने वाले किसी भी एग्जाम में रहता ही है. आप पास्ट क्वेश्चन जब उठाओगे तो आपको रियलाइज होगा कि many times we have been discussing some drugs that are being asked in 1 to 2 exams later. Sometime it is asked in the subsequent exam. So PCABs के बारे में आजकल बहुत डिस्कशन हो रहा है. पोटेशियम कम्पिटिटिव एसिड ब्लॉकर. पोटेशियम कम्पिटिटिव एसिड ब्लॉकर. So they are mainly like proton pump inhibitor, but they are not proton pump inhibitor. Potassium competitive acid blocker. So they are mainly going to compete with the potassium side because there is a hydrogen potassium ATPase, उसको inhibit करता है. Acid blocker. They are actually similar to PPI but better pharmacokinetic property. They are much better than proton pump inhibitors. ठीक है. Which of the following is a PCAB among the following? Fedotozine, Tinapanor, है ना, ये सब ओपियोइड वाले ड्रग हैं. Tigoprazan, Prucalopride. Prucalopride is one of the 5-HT4 agonist. That is a prokinetic agent. ये तो prokinetic, ये तो काफी पुराना ड्रग है. I think most of you are giving the correct answer. The correct answer for this one is Tigoprazan, Vonoprazan. These are the drugs. So Vonoprazan, Tegoprazan and Qivarprazan. These are the PCABs. The advantage of the PCAB is that they are acid stable. Unlike the PPIs that were acid labile, they are acid stable drug. Their enteric coating is not required. PPIs के साथ enteric coating required है. They are effective also for erosive GERD. They are active compounds. PPIs are actually prodrug. They were getting metabolized to form sulfinamide, but these are active compound. Their primary metabolism is not by CYP2C19, unlike omeprazole that we saw that could not be given by omeprazole could not be given by your drugs like clopidogrel, but iska CYP3A4 binds with the hydrogen potassium ATPase and bind with the active and inactive pump both. Always remember, PPIs are more sensitive for inactive pumps. इसीलिए उसको early morning before breakfast देते हैं. Because in the early morning before breakfast, only around 10 to 15% of proton pumps are actively working. After meal, there will be stretching of the stomach, and that will be causing more activation of the those pumps. तो इसीलिए early morning before breakfast इसको देते हैं, ध्यान रखिएगा. But इसको कभी भी दे सकते हैं. Dosing around meal is not required, है ना. PPIs dosing around meal for effective therapy, dosing around meal is required, but with this one, dosing around meal is not required. So remember, Prazan वाले जो drug हैं, Prazan, they are PCABs. Prazans are PCABs. I repeat, Prazans are PCABs. अगर आप NEET PG में नहीं देखोगे तो there are high chances आपको आने वाले INICET में आपको ये दिख सकता है. INICET का ये future MCQ है. Future MCQ, ठीक है. Prazans. A 50-year-old patient psychotic symptom started with the drug A. Patient got no improvement by haloperidol, okay, and thiodazine. This new drug A is causing increased salivation, hyperlipidemia, sedation. So अब देखिए, अभी मैंने बताया था salivation, hyperlipidemia, ये कौन सा ड्रग करा सकता है ना? Wet pillow syndrome, that will be caused by clozapine, है ना? याद है, बताया था मैंने. The clozapine के बारे में we have studied this already. A patient on chemotherapy coming to thrombocytopenia, which of the following will be preferred? Thrombocytopenia, darbepoetin, this is mainly utilized for anemia. Filgrastim, they are the granulocyte colony stimulating factor. They are mainly utilized for neutropenia. If there is a chemo-induced neutropenia, oprelvekine is the one that is interleukin 11 agonist. So thrombocytopenia में ये required होगा. Sergramostim is the granulocyte monocyte stimulant. They can also be utilized for neutropenia. ठीक है. Correct answer for this one is going to be C. Asthma patient with management therapy presented with whitish oral thrust. बार बार ये क्वेश्चन आता है, whitish oral thrust. तो या तो आप निस्टाटिन यूज कर लीजिए या क्लोट्रिमाजोल यूज कर लीजिए, क्लोट्रिमाजोल, और यू कैन एडवाइज द पेशेंट टू गार्गल आफ्टर ईच डोज, गार्गल आफ्टर ईच डोज ऑफ द स्टेरॉइड. ठीक है, स्टेरॉइड जो इनहेलेशनल एजेंट रूट से ले रहा है, तो ओरल थ्रस्ट उसी से होता है. ठीक है, so that is going to be your clotrimazole. 5-flucytosine is mainly utilized for your serious infection like like your CNS infection, fungal CNS infection में यूज़ करेंगे, है ना. टर्बिनाफिन लाइक ओनिकोमाइकोसिस डर्मेटोफाइटोसिस में यूज़ कर सकते हैं. गाउट पेशेंट और एंटी गाउट मेडिकेशन विच डिक्रीजेज यूरिक एसिड बाय डिक्रीजिंग प्रोडक्शन. सो डिक्रीजिंग प्रोडक्शन का मतलब क्या हुआ? क्रिप्टोकोकल नियोफॉर्मेंस या क्रिप्टोकोकल मेनिंजाइटिस में यूज़ करते हैं. यस, 5-फ्लूसाइटोसिन. ठीक है. डिक्रीजिंग प्रोडक्शन की बात करेंगे. So that is mainly the xanthine oxidase inhibitor. The name of the drugs are going to be your allopurinol, febuxostat. तो यहाँ पे तो यही पूछ रहा है decreasing the production, that is going to be allopurinol. Probenecid, they are going to increase the uric acid का excretion, है ना. So they are known as uricosuric agent. Uricosuric agent. Diclofenac and colchicine, they have no role on the level of uric acid. They are acute setting वाले drug. They can be utilized in the acute condition, and they have no role on the level of uric acid. They are just anti-inflammatory drug. Uricosuric में probenecid. Other drugs are going to be your lesinurad, benzbromarone, sulfinpyrazone. Now ध्यान रखिएगा, if you want to increase the uric acid, we are also having if you want to decrease the uric acid, we are also having a recombinant uricase that can increase the metabolism of uric acid. ये uric acid को metabolize कर देता है to allantoin, which is one of the water soluble metabolite. Drugs like your rasburicase and p-glotticase. Drugs like your rasburicase and p-glotticase. Rasburicase and p-glotticase. ठीक है. सो अगेन गाउट पे तो एक क्वेश्चन आता ही आता है. आई डोंट नो गाउट के साथ क्या फैंटेसी, एग्जामिनर का एक क्वेश्चन बार बार आता है. तो जितने भी 3 क्लास ऑफ ड्रग मैंने आपको बताए थे, डिक्रीजिंग द प्रोडक्शन वाले ड्रग, इंक्रीजिंग द यूरिक एसिड एक्सक्रीशन एंड रिकम्बिनेंट यूरिक एसिड, ये तीनों के तीनों क्रोनिक वाले हैं. दे आर ऑल यूज्ड इन द क्रोनिक वन. इम्यून चेक पॉइंट इनहिबिटर. इम्यून चेक पॉइंट इनहिबिटर सेकुकिनुमैब. सेकुकिनुमैब इज वन ऑफ द इंटरल्यूकिन 17. नाम में 17 है, 17 इंटरल्यूकिन फॉर क्रोनिक प्लैक सोरियासिस. For chronic plaque psoriasis. Retifanlimab, margetuximab, mepolizumab. ठीक है. Mepolizumab, it's one of the interleukin 5 inhibitor that can be utilized in bronchial asthma and COPD. वो भी रूल आउट हो गया. ठीक है. Margetuximab, pertuzumab, trastuzumab, they are mainly utilized for HER2/neu positive breast cancer. They are HER2/neu blocker, HER2/neu positive breast cancer. So उसमें trastuzumab, pertuzumab, margetuximab, these are the drugs that can be utilized. Retifanlimab is the rule, है ना, that is mainly utilized for your Merkel cell carcinoma के लिए approved हुआ है भी. They are one of the, Retifanlimab is one of the immune checkpoint inhibitor. इसी का दूसरा नाम होता है PD-1 inhibitor. So PD-1 या immune checkpoint inhibitor are going to be drugs like pembrolizumab. We have drugs like your pembrolizumab, atezolizumab. अगर आप मेरा इसके पहले वाला वीडियो देखे थे, the newer drugs on the same platform here only on the PW Medit के प्लेटफॉर्म पे अवेलेबल है. आप उसको एक बार देख लीजिएगा. उसमें सारे न्यूअर ड्रग्स के बारे में मैंने डिस्कस किया था, और वहाँ पे भी आई डिस्कस दिस वन. ठीक है. तो बिकॉज एम्स में एक क्वेश्चन डेफिनेटली रहता है, और आपके इस वाले नीट पीजी में भी एक क्वेश्चन एक्सपेक्टेड है इम्यून चेक पॉइंट से. ठीक है. तो पेम्ब्रोलिजुमैब, एटेजोलिजुमैब, निवोलुमैब, सेमिप्लीमैब, एवेलुमैब, रेटिफैनलिमैब, ठीक है, डुरवैलुमैब एंड डोस्टारलिमैब. दीज आर योर इम्यून चेक पॉइंट इनहिबिटर. इसको मैं बोलता हूँ, याद कर लिए, सिंपल निमोनिक से पैन कार्ड. पैन कार्ड अगर नहीं है तो आपको, है ना, एंट्री नहीं मिलेगी इम्यून चेक पॉइंट पे पकड़े जाओगे. ठीक है. दीज आर द पैन कार्ड वाले ड्रग. पेम्ब्रोलिजुमैब दैट हैज गॉट रिसेंट अप्रूवल फॉर एडवांस एंडोमेट्रियल कार्सिनोमा. देयर इज ए ट्रायल ऑल्सो, पेम्ब्रोलिजुमैब with chemotherapy in इन लंग कैंसर, स्क्वैमस सेल लंग कार्सिनोमा में, इसको बोलते हैं की नोट 189 ट्रायल। इस पे भी एक क्वेश्चन एम्स में आया हुआ है। की नोट 189 ट्रायल इज यूटिलाइज फॉर, की नोट 189 ट्रायल इज मेनली यूज ऑफ पेम्ब्रोलिजुमाब विथ कीमोथेरेपी, है ना, इन स्मॉल सेल लंग कैंसर। ठीक है, ऑलराइट, पेम्ब्रोलिजुमाब विथ कीमोथेरेपी। पेम्ब्रोलिजुमाब को रिसेंटली अभी 2023 में दे हैव गॉट अप्रूवल आल्सो फॉर एडवांस एंडोमेट्रियल कार्सिनोमा, एडवांस एंडोमेट्रियल कार्सिनोमा, इट हैज गॉट अप्रूवल। ठीक है, पेम्ब्रोलिजुमाब। तो पैन कार्ड इज अ वेरी वेरी सिंपल नेमोनिक टू रिमेंबर ऑल द इम्यून चेक पॉइंट इनहिबिटर, है ना। इसके जो इस पाथवे के जो फाउंडर थे उनको वेरी रिसेंटली दे वर गिवन नोबेल प्राइज 2018 के अराउंड, उसी की वजह से इस पर काफ़ी क्वेश्चन भी आजकल आ रहे हैं। A 65-year-old male on levodopa therapy from last year, now he developed bradykinesia. Hours after the drug intake, which of the following drug is newly approved for this condition? So, bradykinesia, that means it's mainly developing off phenomena, on-off phenomena. तो among the given on off phenomena, oprelvecin तो यूज नहीं करेंगे बिकॉज ये तो इंटरल्यूकिन 11 एगोनिस्ट है, इससे कोई मतलब ही नहीं है पार्किंसन से। Opicapone, it's one of the COMT inhibitor, the recently approved COMT inhibitor that will be utilized. We do not have any use of obidoxime. obidoxime तो एक ऑक्साइम्स है ना, ये तो ऑर्गेनोफॉस्फेट पॉइजनिंग में यूज करते हैं, ओपी पॉइजनिंग में यूज करते हैं। Omecamtiv mecarbil, it's one of the drug for chronic congestive heart failure that is going to increase the myosin chain activation, myosin light chain kinase activation. Opicapone. So off phenomena के लिए we are having a drug that is safinamide, we are having a drug that is your entacapone, opicapone, it's one of the COMT inhibitor, entacapone, opicapone यूज कर सकते हैं। एंड epomorphine, remember it's one of the dopamine, non-ergot-dopamine receptor agonist, epomorphine. So these are the safinamide, safinamide, it is one of the MAO-B inhibitor, entacapone or opicapone, they are the COMT inhibitor, and epomorphine, it's one of the dopamine receptor agonist, non-ergot dopamine receptor agonist. Ranolazine is a recently approved drug, trimetazidine, ranolazine, तो फैटी एसिड सिंथेज नहीं, फैटी एसिड ऑक्सीडेशन इनहिबिटर है, एंड दे आर लेट सोडियम करंट इनफ्लक्स इनहिबिटर, लेट सोडियम करंट को इनहिबिट करते हैं, एंड बिकॉज ऑफ दिस दे आर गोइंग टू इनहिबिट द NCX का एक्टिवेशन, because of this they are inhibiting the NCX activation, and they decrease the intracellular calcium load, intracellular calcium load को कम कर देते हैं, which was mainly seen due to the activation of this late sodium channel, है ना। They are actually a fatty acid oxidation inhibitor as well, but this late sodium influx inhibitor, it is considered as the main mechanism of action. This is the main mechanism of action. Although ranolazine is a fatty acid oxidation inhibitor, ranolazine, trimetazidine, है ना, they are the fatty acid oxidation inhibitor. trimetazidine भी है इसमें, लेकिन currently they are saying the main mechanism of action of ranolazine लेट वाले सोडियम को बोलता है नहीं जाने दूंगा, या जाने नहीं देता है, लेट सोडियम को जाने नहीं देता है, सोडियम जो लेट आता है उसको जाने नहीं देता, लेट सोडियम इनफ्लक्स इनहिबिटर, लुक एट द नेम, लेट सोडियम इनफ्लक्स इनहिबिटर, दैट इज द मेन मैकेनिज्म ऑफ एक्शन. Which of the following is the 5-HT4 agonist utilized? So 5-HT4 agonist is going to be prucalopride, है ना. Lorcaserin, it's one of the 5-HT2. Lorcaserin, ये 5-HT2 का मेनली हमें एंटागनिस्ट यूज करना होता है, लेकिन ये एगोनिस्ट है, मेनली यूटिलाइज फॉर ओबेसिटी, लोड को कम कर देता है. फ्लिबांसेरिन, इट्स वन ऑफ द 5-HT1A का एगोनिस्ट एंड 5-HT2 का एंटागोनिस्ट फॉर हाइपोएक्टिव सेक्सुअल डिजायर इन फीमेल वायग्रा भी बोलते हैं इसको, फीमेल वायग्रा, हाइपोएक्टिव सेक्सुअल डिजायर इन फीमेल. द नेम ऑफ द कंपाउंड इज योर फ्लिबांसेरिन, फीमेल के लिबिडो को इंक्रीज कर देता है. स्ट्राडेफिलिन इज वन ऑफ द एडेनोसिन एंटागनिस्ट दैट इज यूटिलाइज्ड मेनली इन योर पार्किंसनिज्म. ठीक है, स्ट्राडेफिलिन, एडेनोसिन A2A रिसेप्टर एंटागनिस्ट यूटिलाइज्ड इन पार्किंसनिज्म. फ्लिबांसेरिन, हाइपोएक्टिव सेक्सुअल डिजायर इन फीमेल. लोरकार्सेरिन 5-HT2, 5-HT2C एगोनिस्ट, स्पेसिफिकली 2C, सी मैंने नहीं लिखा शायद यहाँ पे, 5-HT2C agonist, ठीक है, for the obesity. I think this is the last question. Pretomanid is a recently approved drug that I already told you. Manid, delamanid, pretomanid. इस पे एक क्वेश्चन डेफिनेटली आप इस एग्जाम में देखिएगा. डेलामिनेट, प्रीटोमिनेट, मैनिड एंड मेड, दे आर द माइकोलिक एसिड सिंथेसिस. ए से एटीपी, इट्स द नेम ऑफ द ड्रग इज बेडाक्विलिन. आरएनए पॉलीमरेज इनहिबिटर, द नेम ऑफ द ड्रग इज रिफाम्पिसिन, है ना. माइकोलिक एसिड सिंथेसिस ऑफ द एमटीबी. अच्छा, इसमें दो ऑप्शन सेम है, ए एंड डी बोथ, दो ऑप्शन सेम है, तो एक ही ऑप्शन को हम मानेंगे, है ना, एक को ही मानेंगे. माइकोलिक एसिड synthesis of the MTP, A and D are simply same. So the correct answer either A or D. So this was everything about this. Remember, the important side effect is that they are going to be associated with the QT prolongation and also they are going to cause hepatotoxicity, liver toxicity भी करेंगे. So this was everything about this 10 का दम, where we have discussed more than 10 drugs. 10 ड्रग तो डिस्कस करना ही था, बट हमने थोड़े बहुत ज़्यादा कर लिए. That is absolutely fine because वो सारे के सारे हाई यील्ड एंड टॉप 10 ड्रग्स हैं. और उसके बाद से टॉप 10 इमेजेस भी मैंने देखे. एंड आफ्टर दैट आई हैव आल्सो डिस्कस विद ऑल ऑफ यू गाइस टॉप 10 MCQs एंड सम ऑफ देम आर आल्सो PYQs. आई होप you guys have enjoyed the session of 10 ka dam. Likewise, you guys can continue to follow the PW channel for the future and upcoming more lectures that we have planned for all of you guys, especially for upcoming NEET PG and FMG aspirants and INICT aspirants. We are having more activity that is aligned for all of you guys. ठीक है, तो आप ऐप को भी डाउनलोड कर सकते हो. एंड इफ़ यू आर वन ऑफ द स्टूडेंट दोज हु हैव गिवन एग्जामिनेशन इन द पास्ट, तो आपको एक फॉर्म भर के यू कैन हैव अ फ्री एक्सेस ऑफ जो PW पे जो भी हमारा कंटेंट है, यू कैन हैव अ फ्री एक्सेस टिल द एग्जामिनेशन. I will see you in my upcoming classes. Thank you very much to all of you guys. If there is anything specifically that you want me to take lecture, you can just put it in the comment section. We'll try to look for it. Right? Chalo. Bye bye to all of you guys. Have a good night.